Hello guys, welcome to this anatomy PYQ session. Just let me know, am I clearly audible and visible to you? Just let me know in the chat box, am I clearly audible and visible to everyone? Welcome to this anatomy PYQ session. Right, I'm waiting for the your response on the chat box. Am I clearly audible and visible to everyone? Perfect, right? Audio, video, perfect. Okay, how's the preparation is going on for this July 2024 FMGE exam? Okay, right. Perfect, perfect. Let's start this session, and this session will be totally based on the your PYQ, right? So we'll talk about all the important PYQs, which is already in your anatomy. We are talking about the mostly the last 4 years, or 4 papers, mostly the last 2 year or 3 years, right? So till the 2023, 2022, and 2021, we'll take like this, right? All the PYQs, and we'll talk with the all with the descriptions. I hope you already had your particular session of anatomy rapid revision. So we'll discuss now here the all the previous year questions, right? Okay, okay. Let's start with the first. We'll talking about all the MCQs and what will be the pattern of this PYQ sessions. Please understand the thing. As you already had your rapid revision session. I hope you already had the full course of your anatomy. Then you had the recently the rapid revision, right? So I want to take this PYQ session as a TND. So I will show the first the question I will show to you, and please try to reply in the chat box, right? If this session will be the more interactive, it will be much better for me and you also, right? So I want to see that how much you got from the PYQs. Okay, so the session will be like that. I will show you the MCQs. You have to try to answer that particular MCQ in the chat box, and after that I will shortly explain you. If you are correct, then it's much good. If not, please understand, if you are not correct in this MCQs, please try to understand the explanation when I'm explaining this particular MCQ. Okay, so this will be much helpful for you. You will not do the same mistakes in the exam, right? So this is a particular session, right? So let's start with the particular let's start with this session, and starting with the question number one. I think question number one is on your screens. A 22-year-old male present with an injury and present with a deformity as it's shown in the image. Which nerve will be the damage in given the condition? So what I can see, the image is given. This is the image is given. Also, the X-ray image is given. Okay, so the X-ray is also given, and the clinical image is also given. Whatever the the patient is facing here, and the all the four options are here. The first is your ulnar nerve. A. The B is your radial nerve. The C is your median nerve, and your D is your musculocutaneous nerve. I will give you the 20 to 30 second, right? I will give you the 20 to 30 second. Please try to answer. Please try to answer. So what is the main key points of this question, right? I'm trying to, very good, very good. I'm trying to highlight the particular important keywords. What is the keywords? The first is the injury, after the injury. So the first is that it's not the normal after the injury and present with the deformity as shown. So first I have to see the deformity. Very good. So as I'm seeing in the deformity, this hand, this wrist is dropped. So what I can see here, very good doctors, very good. So what I can see the wrist drop. Very good, right? So there is the wrist drop is seen. Very good in the image. And which nerve will be damaged? So the particularly the question is asking that which nerve will be damaged. So there is a two things is given. The first is the image, which is the wrist drop, and I hope that everyone is know about the all of the nerves. You are understand the very well about the ulnar nerve, about the radial, about the medial, and the musculocutaneous. You read in the brief about this all the important. These topics are very important about these nerves and about all the brachial plexus. I hope you studied very well the brachial plexus, right? So from this brachial plexus, the wrist drop is seen in which condition? Very good. The first is very good. Your everyone is correct. This is seen in your radial nerve injury, right? This is seen. The wrist drop is seen in your radial nerve. Agree with you, right? Now, the two things which you have to see here, what the two things we have to see, please understand. It's not only by the wrist drop, as I not assumed by this only the wrist drop, although I'm seeing a X-ray image also. And what I can see, the shaft of the humerus. Where is the fracture? The shaft of the humerus. So I hope you remember this. Sometime in the orthopedics also this question is coming in like in the different way. What they are giving, they are directly giving you this image. There is a shaft of the humerus is fractured, so which nerve will be injured, right? So that is also your radial nerve. So please remember, from the shaft of the nerve, here the passing the which nerve, your radial nerve is passing from here. So I hope what will be the two important. First, you saw this, the shaft of the humerus is a fracture. Yes, the fracture of shaft of the humerus. Although I can see in the clinical, what is the scene? There is a wrist drop is seen, and you already know the wrist drop is seen particularly in which condition? In the radial nerve injury, right? So the what is your answer? Yes, your answer is your radial nerve, right? Your answer is your radial nerve. Everyone is correct. You answered the B. Yes, it's radial nerve, right? So you can, yes, directly, exactly, doctor. You can get this question in the with the X-ray also. If the X-ray is only the given, this will be also the correct for you, that shaft of humerus is fractured. So radial nerve is passing from the shaft of the humerus, and the most common nerve is injured in the shaft of the fracture of humerus. Please understand, most common nerve which is getting damaged in the fracture of shaft of the humerus, this will be your radial only, right? And although on the second clinical image vintage we saw there's a wrist drop is seen, and wrist drop is seen particularly in which injury of which nerve? Yes, it is exactly, it is your radial nerve, right? Very good, very good. So in the explanation, please understand, this is a scenario which image is shown you, that is your wrist drop. We talked about it. The wrist drop is seen here, and the fracture of the shaft of humerus. These two are your clinical key points, right? If you saw this key point, the answer will be there, right? As you already know, there will be the is humerus, there will be the damage of the radial nerve, and the radial nerve is responsible for the innervation of muscle in the posterior compartment of arm and the posterior compartment of forearm and in the hand also, right? So I hope you remember this. The radial, what is the supply of the radial? Yes, the radial is your supplying your posterior compartment of the arm, posterior compartment of the forearm, and coming into your hand, right? And supplying in your hand. And please remember, it's play a crucial role in the wrist extension, right? So the radial nerve is the main crucial work is the wrist extension. So if wrist cannot extend, right? So if the radial nerve, this is the wrist extension, right? So this is the wrist extension. But if the injury of this radial nerve will be happen, so this wrist extension will be not possible, and that's why this wrist will be dropped, right? And this is the clinical image which is shown in this particular MCQ. This is known as the wrist drop. Wrist drop. All right. Did you understand this particular wrist drop and the radial nerve injury clinical point? Right. Very good. Okay. Very good. And please remember, this question is particularly from your topic of brachial plexus. So the brachial plexus is very important. Maybe they can ask you some question related to the ulnar nerve. Of course, they asked already. We'll talk about that also. Median nerve and the musculocutaneous nerve also. Okay, let's move forward for the second MCQ, right? Let's move forward for the MCQ number 2. Okay, so this will be your MCQ number 2. I'm waiting for your answers. I'm waiting for your answers, guys. What is the question is written here? Please understand the thing. A person who had a road traffic accident presented to the ER with the injury of the bulbar urethra. And what will be the location now? What will be the location of collection of the urine due to this injury? So the person is having a road traffic accident. The keywords, if I'm talking about it, road traffic accident, presented to the emergency room. And please understand the thing, there's an injury to the bulbar urethra. What is the site of the injury? Yes, your site of the injury, is your bulbar urethra. And what can be the location of collection of the urine due to this injury? So if I'm talking about is a one liner, this is a clinical vintage given. If I'm converting it to the one liner, what is the question is asked by the particularly by the examiner? that if the injury at the site of bulbar urethra, where where will be collected. That's a simple clinical, that is a simple one liner, right? But they make nowadays what in the FMG, they are creating a clinical case base, right? So please try to understand this clinical base. Please try to catch all the key points, okay? And the option is given here, the inguinal pouch, the B is your peritoneal cavity, and C is your esophageal fossa, and D is your anterior abdominal wall. So what will be your answers, guys? Try to answer in the chat box. I'm waiting for your answers. Who all are watching this live, please try to answer in the chat box, right? Very good, very good. Okay, so your answer will be here, D, right? The anterior abdominal wall. What is the answer? Your answer is your anterior abdominal wall. Very good. Who are answering the D? Now, why the anterior abdominal of the wall? We'll talk about it. Please understand. Your answer is correct, right? Correct answer is your D, anterior abdominal wall. If I'm talking about this particular injury of the bulbar urethra, so please understand this particular topic, that if the injury at the bulbar urethra, and you already know from the anatomically, the bulbar urethra is a part of male urethra, right? This is just located. What is the location of the bulbar urethra? This is just located before the penile urethra. This is located at just before the penile urethra. And please understand the thing, if the injury to this bulbar urethra, what is the question they can ask you? Maybe they given this time with the anterior abdominal wall, maybe in the next time they can change the options also. So please try to understand this topic particularly. The bulbar urethra, you already know, this is a part of the male urethra, which is located just before the, as the penile urethra will be started. And if the injury of this particular bulbar urethra, it can be lead to the urethral rupture. What it can be lead? Yes, it can be lead to your urethral rupture. Okay, so if the injury of the bulbar urethra, it is called as your urethral rupture. If the urethra is getting ruptured, this is known as the urethral rupture, and it allowing to urine to leak into the surrounding tissues. Of course, as you already know, the urethra is the conduction of the urine from the bladder to the outside, right? Right. So bladder to the outside. So if this urethra is getting leaked out, so there will be the urine will be split into the your surroundings. And in the case of the bulbar urethral rupture, the urine can be extravasates to what the structure. Please remember this four structure. What you have to do? You have to remember this four important structure. If the bulbar urethral injury, or you can understand if the urethral rupture is there, so due to this urethral rupture, due to this bulbar urethral rupture, what surroundings are there where the urine can be leaked out? The first is your superficial perineal pouch. So first is your superficial perineal pouch. The second is your scrotum. Yes, it can go to the scrotum also, right? As I already told you, what is the location of it? You already know. What is the location of this bulbar urethra? As the penile urethra will be getting started at the base of it, right? So it can go to the scrotum also. With the scrotum, it can go to the penile region. It can also go to your penile region. And the last is can pass into your anterior abdominal wall. So please understand the thing. Maybe this time they can create any other clinical scenario. And in the options, they didn't mention your anterior abdominal wall. Maybe they can mention the scrotum, or maybe they can mention your superficial perineal pouch. So please remember this. If the injury of your bulbar urethra, that is known as your bulbar urethral rupture. And in this bulbar urethral rupture, what will be where urine can be leaked out? Yes, your urine can be leaked out into your superficial perineal pouch, scrotum, penile region, and into your anterior abdominal wall, right? Okay, so you understand this thing, right? Let's start with the next MCQ, the third previous year question. In this PYQ, the particularly is asked that a 27-year-old male was climbing the stairs and suddenly fall on a iron nail, and this iron nail is hit on the neck, where it will be hit on the neck. And after the injury, the patient is having a hard time. He is having hard time struggling his shoulder, and he is also having, what is the thing, not only this having the struggling of the shoulder, this issue is not only the struggling of the shoulders, what the other, what's the other, yes, the other is, and he is having the difficulty in turning the his head. So the, what is the two important thing, what I can mark here? So the first thing, there will be the injury of the iron nail on his neck. The first thing, what is the site of injury? Site of injury is on the neck. The second is your, the patient is having the hard time to the struggling his shoulders. Okay, having a hard time struggling his shoulders and difficulty in turning his head. So this is all is given as the your clinical key points. So it is asking you, this might be due to the an injury of, what will be this? There will be injury of, right? The A is the spinal accessory nerve. B is your deltoid muscle. Yes, C is your sternocleidomastoid muscle, and D is your long thoracic nerve, right? Long thoracic nerve. So the MCQ is clinically by the your only purely by the anatomically. So if you have the knowledge of anatomy, very good, guys. Please understand the thing. There is a question they asking you about the injury. Please understand the thing. It is not asking you that which muscle is getting affected. Okay, please understand the thing. What our mind is saying, our mind is answering about the other things. What is they are asking, we are not seeing that. What? Just we studied this. Okay, nail hit on the neck, struggling to shoulder, difficulty turning in the hand, and we answered it. No, please understand, this is due to injury too. The question is asking what will be getting injured due to this is happening. So your answer will be exactly, guys. I'm getting only the 2-3 answers. What about the others who are watching live? What about the others? Try to answer it. It's a very good clinical case. It's a very good clinical case. Exactly. The answer will be your spinal accessory nerve. Your answer will be your spinal accessory nerve. Right? Who answered correctly? It's too good. Who didn't, please now understand the thing, why the spinal accessory nerve is the answer. Why the spinal accessory nerve is the answer. Now, as we already talked, your spinal accessory nerve is the correct answer. And if I'm talking about it, now please understand the thing, doctors, it's not the sternocleidomastoid muscle. Please understand the thing. The spinal accessory nerve, which is your ninth nerve, right? Cranial nerve 9th, right? Spinal 11th, sorry. It's your 11th accessory nerve, 11th cranial nerve, the spinal accessory nerve, and is responsible for the your innervating the trapezius and the sternocleidomastoid muscle. Exactly. I agree with you, doctors who are answering the sternocleidomastoid muscle. I understand the muscle is getting affected, but now again I'm mentioning you. The question is asking what they might be due to the injury too. Can you understand the thing? Can you understand the thing? How the examiner is trying to confusing you. I know, I know. Yeah, I understand. Please understand the thing. The question is asking here, injury to what? Okay, it's not only by the slugging the shoulders or not only the moving the neck, just the both of it, right? So not only the sternocleidomastoid muscle, the trapezius also will be there, right? So the question is asking you the injury to the spinal accessory nerve that can cause to this, right? That can cause to this. Please understand. In the scenario, the patient is having difficulty in the struggling his shoulder, as we talked about it, and the his head is suggested to issue with the spinal accessory nerve, and which will be control these muscles. The both of the muscle, the trapezius also, the sternocleidomastoid, both will be there, right? Both will be there. And the injury by the nerve which is hitting in the neck, that should be damaged, the impeding this spinal accessory nerve, leading to this system, right? Yes, exactly, doctor. Because there is a not only the one, there is a not only the sternocleidomastoid, trapezius is also involved, right? Trapezius is also involved, right? And please understand the thing, there will be the not injury if the only nail, the nail is very smaller, right? Nail is very smaller. Can you understand? Which is hitted on the neck, right? So it's not the possible that whole the both of the muscle can be damage there, right? Not possible there, right? So this will be the question. So this is the main trick. where the examiner is trying to confuse you. So that's why I'm highlighting it. I'm highlighting this particular key point which you have to see always and always in the questions in the last, because the examiner is trying to confuse you in this particular points only. Now in the last he asked you what is the an injury to, maybe he can ask with out of this all the muscles which muscle is getting affected, so your answer will be your sternocleidomastoid muscle. If the trapezius, rather than this sternocleidomastoid muscle, there is a trapezius, you can answer the trapezius, right? But there he is asking about the your damage to which the injury is on which particular structure, so your answer should be your spinal accessory now. So your answer should be your spinal accessory now, right? Perfect. Agree? Okay, so don't be confused and please understand, in the last they are making some important topics. In the last they are confusing you. In the starting of the topic you are understanding that question is very easy, right? This will be the very easy, but what you are thinking, you are not seeing this last point. Maybe they can ask you not true, right? Anna, or the true accept. So these words are little bit making confusions in this situation. Okay, so please try to read the MCQ carefully and then try to answer. Okay, so whoever answered the sternocleidomastoid muscle in this particular answer, yes, I understand, I agree with you. The sternocleidomastoid muscle will be affected here, but the injury to the your spinal accessory nerve can damage to your trapezius muscle nerve supply also and your sternocleidomastoid muscles also. And due to this affecting of this both of the muscle, the patient cannot struggle the whole this shoulders and the difficulty in having in the turning this neck. Okay, agree with me? Sure. Okay, okay. Now the question number 4. Now starting with the question number 4 in front of your screens. A 42-year-old female who had the extraction of the third molar tooth. So I'm marking the all the key points in this MCQs, so you can try to catch the all the key points in the exam day, right? Okay, sir, all subject PYQ started, please. Of course, this is the series of the PYQ. I think you saw the name of this session, anatomy PYQ session 1, right? The all the remaining sessions are there. All more remaining sessions are there. Just wait for it. Okay, just wait for it. Okay, so the question is here: the 42-year-old female who had the extraction of her third molar tooth reported to the loss of sensation. Now, the loss of sensation where in the anterior two-third of the tongue. Now, if the affected is only the anterior two-third of the tongue, anterior part, and the floor of mouth also. And the question is asking which nerve is the most likely to be damaged. Please understand, they are asking you most likely to be damaged. Okay, the question is asking you most likely to be damaged. So you understand the first option is given here, the lingual nerve, glossopharyngeal nerve, spinal accessory nerve, and your last is your chorda tympani. Chorda tympani. Now, please understand the thing. There, the two particular key points are there. If you're catching this key point, the loss of sensation. The first is your loss of sensation of anterior two-third of the tongue, and the second is your floor of the mouth also is affected. And exactly, very good, doctors, very good, brilliant, right? So this will be your lingual nerve, right? So answer should be your lingual nerve, exactly. So why the lingual nerve, right? Why the lingual nerve? Please understand this lingual nerve. All the course of the lingual nerve we have to talk about it. So your lingual nerve is your branch of your mandibular division of your trigeminal nerve. Which now? Trigeminal nerve. Okay. So your lingual nerve is a branch of your mandibular division, right? You already know the trigeminal is divided on the face into three parts, three divisions is given, right? So the third division, which is your mandibular division, this mandibular division of this trigeminal nerve, which is the V3, which is known as the V3 division 3, right? This will be given. This trigeminal will be given the mandibular division, and this mandibular division giving a branch of the lingual nerve, right? So the lingual nerve is this, right? And it's provide a sensory innervation. What it this lingual nerve provide is this particularly this lingual nerve is provide as the inner this particular lingual nerve is provide as the sensory supply of the anterior two-third of the tongue and the floor of the mouth. And now you understand the thing. What is the supply of the lingual nerve? What is the supply of the lingual nerve? They clearly mentioned in the MCQ that there will be the anterior two-third of the tongue and the floor of mouth will be getting loss of the sensation. And by the seeing this particular key point, you can understand the thing that there will be the injury of your lingual nerve, right? Right. So what is the lingual nerve? Please understand with me. What is your lingual nerve? Lingual nerve is a branch of lingual nerve is a branch of your mandibular division of your trigeminal nerve. And this will be, what is the function of this lingual nerve? Exactly, your function of your this lingual nerve is the first getting the sensory innervation from the anterior two-third part of your tongue and the floor of the mouth. And the damage of the lingual nerve is due to the extraction of the third molar tooth, is also known as your wisdom tooth. What is known as your wisdom tooth, right? जिसको हम हिंदी में क्या बोलते हैं? अक्कल दांत, right? That is a wisdom tooth. So I'm highlighting all the points which is mentioned in the MCQ. So the clinical MCQ is clearly giving you the suggestion of it. Given the clinical, particularly clinical features of what? The clinical feature of the loss of sensation in your anterior two-third of the tongue and the floor of the mouth. Clearly it is going for the lingual nerve. Also the given, right? So there will be the given of that particularly. There is a given of the particularly, okay? There is a given of the particularly the third molar extraction by the female, right? So this is also the wisdom tooth, and it can be result to this loss of sensation in such areas. Exactly, the occult dart, wisdom tooth. Okay, so now you can understand the particular clinical scenario which is made by the examiner is clearly given us the answer. Just what we have to do, we have to catch the key points. If you know about that particular nerve and you know the innervation of the nerve, from where it will be getting innervated, the second thing, you know from where it will be going to supply, you can easily get this particular question, right? Okay, let's move forward. Moving forward for the question number 5, and the question number 5 in front of you. Very good MCQ, 2 to 3 times repeated in your FMG and 2 to 3 times also repeated in your NEET PG exam also. All right. So this is very important topic. Okay. Let me know in the chat box. What is the question? Which bone is the most likely to be fractured in the injury to the anatomical snuffbox? Which bone is the most likely to be fractured in an injury of anatomical snuffbox? The first of all, I hope you know about the structures related to your anatomical snuffbox, right? If not, I will surely try to explain you. About the anatomical snuffbox. It is a very important topic. Okay. And related to this, whatever all the MCQs are there, we'll talk about this all the MCQs. So here it is asking about the fractured bone. They are asking about the bone. Okay. And the options are given: A, scaphoid; B, lunar; C, cuboid, and the last D is your trapezius. So what will be your answers? I'm waiting for your answers in the chat box. I'm giving you 5 to 10 seconds. Who is watching the live, please try to answer. If it is wrong here, please understand the thing. अगर आप लोग यहाँ गलती कर रहे हो, कोई issue नहीं है. Okay, you will not repeat the same mistake in the exam. Please understand the thing. Just try to reply in the chat box. Okay, just try to reply in the chat box. Okay, so yes, your answer should be here, scaphoid. Your answer will be here, the scaphoid bone. The scaphoid bone will be fractured if the injury of your anatomical snuffbox. So now answer is your scaphoid, right? So the scaphoid bone. Just I want to explain you about the anatomy of your snuffbox. The anatomy of your anatomical snub box is very, very important. Whatever the questions can be asked here, I already mentioned in this particular image. If you remember this image, if you remember this image, that is a much, much, much better for you to solve all the MCQs of the anatomical snub box. So whatever the questions can be asked, they can ask you about the boundaries. The most common question can be asked here. They can ask you the bone, which we already just saw here, and maybe they can ask you about the artery. Okay, so let's start with it. Let's start with it. And if I'm talking about here, so if you're talking about the boundaries, so there will be the ligaments which are making these boundaries on the lateral side, right? On the lateral side, we are seeing there is the extensor pollicis brevis as the base of the proximal phalanx, right? This is the first, which is here, right? You can see here. And the second is your abductor pollis longus on the base of the first metacarpal. If we're talking about the medial side, on the medial we have the extensor pollis longus at the base of distal phalanx, right? Very good. On the lateral we have, exactly, on the lateral we have EPB, your extensor pollis brevis, very good, right? And what we have the APL, adductor pollis longus. This will be on the lateral side. On the medial side, what we have? We have the, on the medial side, what we have? We have the EPL. What we have? EPL, right? Extensor pollis longus, extensor pollis longus. And please understand, and if we're talking about on the base of it, which bone will be there? So the bone will be your trapezium and scaphoid. This, the both will be on the base of it. Okay, both will be there. But if we're asking about the most common fracture, the most common fracture will be seen in your scaphoid. If they're asking about the anatomical snub box and asking related to the bone fracture, your answer should be always and always scaphoid only, because the scaphoid is the most common. The scaphoid is your most common bone which can be getting fractured at the injury of your anatomical snub box, of the anatomical snub box. The more question they can ask you, which artery can be injured, which artery can be injured. Please understand this thing. If they mention you, there will be the injury on your anatomical snub box and the artery will be getting damaged. The bleeding will be not stopping there. The bleeding will be getting more and more. And which artery is bleeding there? So what will be your answer? Yes, your answer should be your radial artery. So please understand, the radial artery is just lying on the scaphoid and the trapezium in the anatomical snub box. So your radial artery is also important. Yes, important structure in the snub box, anatomical snub box. What? Your radial artery. Radial artery. Okay. So this is all about the important about your anatomical snub box. About the boundaries they are asking, about the bone of the base, bone fracture they are asking, and they can ask you about the artery also. They can ask you about the artery also, right? So remember with this, if you remember this much about the anatomical snub box, there will be this. Surely if the question is coming from the anatomical snub box, any type of the question is coming from this anatomical snub box, you will be getting correct this particular MCQ, right? So if we're talking about the explanation of that particular question which they ask about this scaphoid bone, so please understand, at the anatomical snub box there is a triangular depression which is located in your radial aspect of the dorsum back of the hand, right? On the back of the hand, you already know this will be your anatomical snub box here, right? And they will be formed by the tendon on the extensor pollis longus and the extensor pollis brevis muscle. Fractured with the anatomical snub box are the commonly associated with the fall onto the outstretched hand. And this is your particular key point for the orthopedics. Maybe in the orthopedics they given you particular MCQ, like they framed the MCQ like that. One patient is walking on the road and he falling down on the outstretched handed. He's falling down on the outstretched handed, right? And the particularly with the wrist extension, please understand what will be there also. Wrist extension should be also there. So wrist extension, if the patient is if the person is going to drop like that, so all the pressure will be on this particular on your hand. So that will be also causing the fracture of the region which is the bone. Yes, your bone is your scaphoid bone. right? Scaphoid bone. And also it's known as the navicular bone also, right? Scaphoid bone, right? So this much you have to remember. I again making here a star because this is a very, very important slide for everyone. If you remember about this, that much about the anatomical snub box, that's enough for you. That's enough for you, right? Should we move forward for the next MCQ? Should we move forward for the next MCQ? Right? Okay. So now, what will be the vertebral level shown at the blue line in the image? And I hope you can see this blue line on the image clearly, or I can draw here again. This one, this blue line. And you can see clearly this blue line is passing from where? Yeah, this blue line is passing from your umbilicus at the level of umbilicus. So what the examiner want to ask? The examiner want to ask this level of the umbilicus. You can say like that, okay? So if their imaginary line is drawn on the umbilicus, the examiner want to asking us about this. So what will be the your, I think this clearly line is visible to you, or I can draw also, right? Now perfect. Okay, so this will be the line. This will be the line which is seen to you. Now answer me, at which level your umbilicus is situated. This is the question, the clear cut question. If I want to summarize this question in a one line, right? What I'm doing, this questions I'm trying to do the concise into the your one lines, right? One liners as a one liner, right? So now answer me, at which level your umbilicus will be there. Everyone who is watching live, I want that you all will be replying the answers. No issues. If you're replying wrong, no issues. I will correct you. I will correct you. I will explain you everything. Just try to answer. Just try to answer. Okay. Okay. So the option is given L2, L3. Your lumbar vertebra 2, lumbar vertebra 3. The B is option L4, L5. Right. And the, yes, the C option is your L5 and S1. And the D option is your L3 and L4. So the most of are replying D, some is replying A, someone is replying B. So what will be your answers? Right? Exactly. Your answer will be B, L4 and L5. Right? What is the correct answer? Your correct answer should be your L4, lumbar vertebra 4 and the lumbar vertebra 5. Now, please understand what the question they're asking you. They're asking you about the L4, L5 refers to your intervertebral space, right? Between the fourth lumbar vertebra and the fifth lumbar vertebra, the space is there. And this common area of the vertebra numbering is often used to refers the reference point in the medical and the anatomical constructions, right? So please understand the thing that particular this area. If you know the L4 and the L5, then we can count above the L3, L2, L1, right? And we can go down also if we want. So this is a particular referencing, okay? This is a particular reference. The umbilicus will be where? Remember now, from now, where will be the umbilicus? Your umbilical will be your L4, L5, okay? L4, L5. Quite easy question. Quite easy question. Just you have to remember it, okay? Let's move forward. Let's move forward. Very good, doctors who are replying correctly. It's too good, right? And who didn't, please understand. Who are not replying correctly, please try to understand the thing. If you have any confusion, you can ask me in the chat box. I will surely try to reply in the chat box, right? Did you understand till here? Should we continue? Should we continue? Right. So the question number 7 is here. A 42-year-old man present with the swelling. The key point I'm catching here. First key point is your swelling is there due to a collection of the blood around the eye, which is sustained a head injury. So the patient has had a head injury, and due to this head injury, now the blood is collected around the eyes. And due to this blood collection, there we are seeing the swelling. We are seeing the swelling. And which structures attached in this cause of this condition? Which structural attachment is cause of this condition? And now you can understand the thing. The D will be not possible. None of the above will be not possible. Cellulitis. The cellulitis is a disease where will be your subcutaneous fatty tissues. The subcutaneous tissues will be getting inflammation, right? So there will be no inflammation, right? There is no given, the clinical history is not given related to your inflammation. What the clearly given in this condition, there is an injury, particularly injury is given, and due to this injury, there is a given of your particularly swelling and the blood collection also. And what is the blood collection? The blood collection can be in the periosteum also. Now, please tell me what is the meaning of the periosteum? What is the meaning of the periosteum? I'm waiting for your answers. Tell me what is the meaning of the periosteum? What will be your periosteum, guys? I'm waiting for your answers. Try to reply, guys. Space around the bone. Very good, doctor. Very good, right? So, is the bone in the bone can be the blood can be collected? Is it possible? There will be the swelling will be there, and more tissues will be attached there. And please understand the thing. Near the eye, there is a aponeurosis. What will be your answer? Your answer will be your aponeurosis attachment. Your answer should be your aponeurosis attachment. Very good. Space around the bone will be known as the periosteum. Outer part of, right? Outermost part of peri. Okay, like pericardium, right? Uh, like periosteum, like that. Okay. So answer should be here the aponeurosis. What would be your answer? Your answer should be here aponeurosis attachment. Perfect. Right. Now, what will be the main clinical in this clinical image? What will be the given in there? That it will be your injury of your, especially around the, when the injury of the person will be head injury, the person had the head injury, and especially around the eyes where the blood can be collected, right? Surrounding the tissue of the rupture. What is the main region of this blood collection? Yes, your blood collection will be there because of there is a rupture of the vessels. Your blood vessels will be getting ruptured, and due to the surrounding tissues, due to the rupture of this blood vessel, the blood can be accumulated into your subcutaneous space, right? As the blood vessels will be getting ruptured, this blood will be getting accumulated in your subcutaneous space, right? And this accumulation of this particular blood into your subcutaneous space can cause your swelling. And now the structural attachment. What is the MCQs? In the MCQ, they didn't ask you about the in which space it is getting accumulated. The blood is getting accumulated in the subcutaneous space, but they particularly asked about it. That with structural attachment that can be contribute this condition in the your is this your aponeurosis attachment. Okay, so your answer should be what? Your answer should be your aponeurotic attachment. Okay, right, guys? Understand this particular MCQ, particular topic also. Should we move forward? Okay, moving forward for the next MCQ and try to answer this particular MCQ. This is a very important MCQ related to your from the your particular related to your ENT, particular related to your anatomy also. Try to answer it. Okay, so a 23-year-old, your a 23-year-old patient, 23-year-old patient present with a swelling below the ear. So what is the below the ear? Yes, below the ear here, the swelling is there. And the complaint of the pain in the lobe of the ear, right? This is the lobe of the ear, you already know. This is the lobe of the ear. So patient is having swelling just below this, uh, just below the earlobe, and is having the pain in the earlobe. The patient is also reported in the difficulty. Now, if I'm talking about it, swelling, the first swelling below the ear, and complain of pain in the lobe of ear, the second clinical. The third, the patient is also report the difficulty in completely closing the left eye. Closing the left eye also will be the third, and the experiencing the troubling while the eating the food. So patient is also experience the trouble while the eating the food. Okay, so this four will be given, and they asked that what now is the most likely damage in this case. The option is given: A, greater auricular nerve, B, auriculotemporal nerve, C, facial nerve, and your D is the vagus nerve. And now, and now, so try to take rapid revision of ophthal possible. Shortly, we'll take about the ophthal also. Let's complete the here about the first. We'll complete about the anatomy PYQs. Right at the time of ophthal also, we'll talk about ophthal. Okay, doctors. All right. So in this particular MCQ, now you can understand as the earlobe is given, just below the earlobe, what we have parotitis, right? This question, this particularly this image, which is the clinical image is given. This is the case of your parotitis. Okay, so your parotid gland, if getting the infection or the getting swelled up and large will be there, so it will be compressing your which now? Yes, it will be going to compressing your facial nerve, and you already know, the facial nerve. The facial nerve is helping to your closing of the eye. Yes or no? Closing of the eye is done by the your seventh cranial nerve. And if the seventh cranial nerve will be getting damaged, so the patient cannot close the eye, and the lag of thalmos will be seen. Right? Lag of thalmos will be seen. Okay. And also the patient is facing the trouble while the eating the food. So this will be also giving this the clinical, this particular clinical case of seventh nerve. Right? Seventh nerve. So this is the particularly your, this particular question is asked for the seventh cranial nerve, which is your facial nerve. And you already know this facial nerve is control your all the facial expressions, including the eye closure and the smiling, and it can be damaged, right? It can be damaged due to the weakness or the paralysis of these muscles. Additionally, it regulates muscle for the eating and swallowing. Please understand, this seventh cranial nerve is also helping in the, is the regulating the muscles in the for the eating and the swallowing also. So this particularly which aligns with this patient with the eating difficulty, so this is your seventh cranial nerve. Yes, the Bell's palsy is totally the different, right? But in this case, what, due to the parotitis, okay, due to the parotitis, right? Parotid gland is here, so due to the enlargement of the swelling of this particular parotid gland, this seventh cranial nerve is having the course from there, it is passing from there, right? In the anatomy, and I think in the ENT also you studied about the seventh cranial nerve passes, right? Okay, so this will be your, right, so this will be your, particularly this will be your seventh cranial nerve, this passing from this side, and due to this compression, due to the compression of this seventh cranial nerve, due to the compression over this seventh cranial nerve, as the parotid gland will be getting enlarged or the swelling, this seventh cranial nerve, facial nerve will be getting, this seventh nerve cranial nerve will be getting compressed, and due to this compression of it, the patient is feeling this all the symptoms, right? Agree? Should we move forward for the next question? Should we move forward for the next question? All right. All right. Okay. Talking about the question number 9, identify the histological image which is given here. So this is the histological particular image which is given there. And now you have to identify by the histological image, you have to identify this is the which type of the epithelium. The question is asking about the epithelium. So if I'm talking about this particular epitheliums, if I'm talking about the particularly about the epithelium, so the option is given the pseudostratified columnar epithelium, non-keratinized squamous epithelium, stratified squamous epithelium, and the last is your transitional epithelium. So what will be your answers? What will be your answers, guys? I'm waiting for your answers. Doctor, sir, isn't umbilical present at the L3, L4? No. The particular umbilicus, please understand in the image. Now just go back and watch the image, see the image. In the image, what is the scene? They attach with the iliac crust. The mostly what they made this imaginary line, the imaginary line is making the iliac crust with the attachment there, and the umbilicus will be there on this imaginary line. Okay, so this particular line which was mentioned there, that will be your L4 L3, L4 L5. Okay, doctor, right? Okay, so what will be the answer? I'm waiting for everyone's answer. I'm waiting for everyone's answer. What are you guys thinking about this particular MCQ? Image is clearly given to you. And let me know in the chat box which kind of epithelium you are seeing in this particular image. Which type of particular image, particular epithelium you are seeing in this image. Yes. Now understand the thing. In this image, I am not seeing the only and only single type of the epithelium. What I'm seeing, if I'm dividing with it with the black color, I'm dividing it with the black color. Now you can see there's a changing of the epithelium is seen in this particular zones, right? Here we have the different type of epithelium, and on the other side we have the different type of epithelium. And you already know, if the one type of epithelium is converted or changed into the different type of epithelium at this particular zone is known as the transitional zone, and this is known as your transitional epithelium. What will be your answer? Yes, your answer will be your transitional epithelium, right? Your answer will be your transitional epithelium. So what is the transitional epithelium cells? Please understand the thing. The transitional epithelium cells towards the lumen at umbrella shaped globular shape. The umbrella shaped globular, which is the basement membrane is straight, where the basement membrane is straight. The basement membrane will be straight, right? And this transitional epithelium is particularly found in your bladder, uterus, and these cells also have the multiple nuclei and your scleropoid appearance at the free surface, right? So what will be your answers? What will be your answers through the image? As you are seeing this image, this particular image of your transitional epithelium, right? So remember the histopathological images also. They can ask you this histopathological image in the anatomy also. Let's move forward for the 10th question. And the question is asking, the nerve supply of the larynx above the level of the vocal cord is supplied by. Very good MCQ related to your ENT subject and the anatomy subject also. Try to reply in the chat box. What will be the answer? What will be the answer? The option is given here. A is your superior laryngeal nerve. B is your recurrent laryngeal nerve. C is your glossopharyngeal nerve. And the D is your external laryngeal nerve. I am waiting for everyone's who are watching this session live. Please try to reply. Please try to reply the answer. Very good, very good. I'm getting the answers in the chat box. What about the others? Only 5-7 students are replying. What about the others who are watching the live? Try to answer, guys. I think I can see the all of you the chat, right? Live chat I can see here. Who all are replying? I can see everyone's reply, right? Try to reply, guys. Okay. Yes. So your answer will be your answer will be here the superior laryngeal nerve. What will be your answer? Your answer will be here superior laryngeal nerve. From the anatomy and from the nerve supply are you studied in this about the vocal cord supply or the laryngeal supply you studied in your ENT subject also. So the nerve supply of the larynx, please understand, the nerve supply of the larynx above the level of the vocal cord is by the superior laryngeal nerve. From what? From the superior laryngeal nerve. And the superior laryngeal nerve is what? Yes, your superior laryngeal nerve is a branch of the vagus nerve, right? Have the vagus nerve. And your vagus nerve is having the two branches, the internal branch and the external branch. This particularly has the superior laryngeal nerve has the two branches. Uh, the first is a internal branch and the external branch. The internal branch provides the sensory fibers. Please understand, this internal branch is supplying the sensory fibers, which will be getting the sensation of the laryngeal mucosa and the vocal cord level, right? Above the vocal cord level. We are talking about the above, okay, just above, right? And the external branch are supplying the motor fibers to the cricothyroid muscle. Which muscle? Cricothyroid muscle. So your cricothyroid muscle will be also getting supply from which now? Yes, it will be also supplied by your superior laryngeal nerve. So your superior laryngeal nerve, now understand the thing. Your superior laryngeal nerve is supplying your larynx just above the vocal cords. The sensory supply by the internal branch of your superior laryngeal nerve, and your motor supply to your cricothyroid muscle by the superior laryngeal nerve, and the branch of the superior laryngeal nerve, which branch? Yes, external branch of this superior laryngeal nerve. And this is all about your laryngeal supply, right? Okay. Okay, talking about the more important the previous year questions, which is also talking about sometimes they are asking more in the deep with your embryology, right? So if you're talking about the embryology, please answer this question. This is a very good question from the embryology from the anatomy and the embryology topic. So a patient present with the cyst, present with the cyst on the neck, right, anterior to the your sternocleidomastoid muscle at the junction of the upper mid third of the muscle, and this cyst due to the presence with the following the embryological clefts. So the particularly the question is asked based on your embryologically about the clefts. He is asking about the clefts. So the cyst on the neck and the anterior to the your sternocleidomastoid. If you're talking about the location of it, there is a junction in the upper and the middle third of the muscle, right? And this cyst will be persistent, right? It will not go inside or outside, right? So it will be persistent. It will remain there. So which of the following embryological clefts, right? Due to which persistence of which of the following embryological clefts? Anyone can answer? Try to answer, guys. The particularly there is the answer should be your options will be given here: first cleft and your second cleft, third cleft, and the fourth cleft. Try to answer me. Try to answer me. I hope you remember about the all of the clefts, all of the pharyngeal clefts, right? All of the pharyngeal clefts. And if we're talking about this particular thing, right? If we're talking about this particular thing, no, thyroglossal cyst will be in anterior side. Doctor, this is not the thyroglossal. It's not the thyroglossal. Please understand. Now I'm explaining you exactly. Your answer should be here. Answer should be here. Second cleft. Okay. Your answer should be here. Second cleft. Okay. What will be the answer? Yes, your second pharyngeal cleft. Your answer should be here. The second pharyngeal cleft. If we're talking about the location of it, now understand it is located between the second and the third pharyngeal arches, and it's normally giving the rise the cervical sinus, a transient structure to be contribute to the development of the tonsillar fossa and the palatine tonsil. Palatine tonsil, right? So the second pharyngeal cleft, if we're talking about it, normally it will give to the rise to your cervical sinuses, and transient to the structure which will be getting contribute your development of your tonsillar fossa, and the palatine tonsil will be also there. However, the persistence, if the persistence of the second cleft, if there is a persistent of the secondary cleft, can be lead to the formation of brachial cyst. So now you understand, doctor, who is answering the thyroglossal cyst? The thyroglossal cyst will be not there. It will be your brachial cyst. It will be your brachial cyst. And I hope now you understand about it. Did you clear with this topic? Right? So this is your topic of your brachial cyst. This will be the topic of your brachial cyst. Right? So the brachial cyst with the remnant of which second second cleft. Right? So this is due to the presence of the persistence of the your second cleft. Right? Very good. Should we move forward? Okay. Again, this is question related to your ENT, right? But the particularly we can talk the anatomy of the nose is asked here. So this is also the base of this particular topic or the particular question is the anatomy only, right? So what is the question? The framework of the external nose. So this is our external nose. So they are asking you about the frame of your external nose, right? So you can write it down here. I'm writing in the bracket ENT. Okay, so this question also you studied in the ENT also and the anatomy also, right? That's the anatomy of the external nose is asked here, right? So let me know. Option A is saying the upper one third is the bony and the lower two third is the cartilaginous. Option B is saying the upper one third, one second is your bony and the lower half is your cartilaginous. The option C is saying the upper two third is the bony and the lower one third is the cartilaginous. And option D is saying that none of the above. Right? From your knowledge of basically, you remember something that there was the one third, two third, one third, two third. So the option B, which is the half, is not possible. And option D, which is the none of above, is not the possible. So now you eliminated these two options. And now just two options remain there, that there is the upper one third is bony and the lower two third is the cartilaginous, and the upper two third is the bony or the lower one third is the cartilaginous. And this is the only the question which they are asking you about from the external nose. So they are asking you for what? They are asking you for the anatomical structuring of the external nose. And what will be the your answer, guys? If I'm talking about this particularly, what will be the your answer for this particular topic? Yes, your particular answer will be for this topic is your, I hope you remember, and you can touch by the field also. You can see this part, the upper part, upper one third part is the bony, and this all the lower two third part, this all the lower two third part which is the remain there. This is your cartilaginous part. This is your cartilaginous part. So your answer should be here, the upper one third. What will be your answer? Yes, your answer should be A. Your answer should be A. Your upper one third, please remember now, upper one third bony. Okay, and the lower two third, is your cartilage. So should we make a mnemonic for it? Right? Yes, exactly. Okay. So bone word itself contain on word. So this will be the remember, that will be remembering the trick, right? Okay, on it means the above one. Okay, so making such a small mnemonic. So I was remembering like the upper is the bony, which is a one third. So I was remembering as a UB 1-3 and the LC is the 2-3, right? So what was the my mnemonic to remembering this? Also you can remember with the bone words also. Okay, like bone itself having the on. Okay, so on words it will be the your trick to remember. You can remember the on, it means the above. Okay, or you can remember like that, the upper one which is the bony, right? Upper bony one third and the lower cartilaginous two third. So I was remembering like that, UB 1-3 and the LC 2-3, 2/3, right? So this will be the your answer for the external nose work frame. Okay, so remember the external nose is work frame is your upper one third is the bony and the lower two third is your cartilaginous, right? So the framework for the external nose is composed of the bone and the cartilaginous. The upper one third made up of the nasal bones and the lower two third is made up of your cartilages, right? I think this you studied in your ENT subject also, and here also you are studying in the anatomy also. So there will be no chances to getting wrong this particular MCQ. as you studied in the both of the subjects, in the ENT and the anatomy. Right? Should we move forward? Should we move forward? Okay, let's move forward. In this question, this particular question, the X-ray is given, and given this X-ray, they are asking you to identify the pulmonary trunk. What they guys are asking? They are asking for the identification of the pulmonary trunk, and the clinically X-ray image is given. So you can understand this can be asked as a radiological MCQs, as per as they can ask this particular MCQ as per the your anatomy also, right? And the MCQ is clearly given, A, B, C, and D. The options are already given there, and uh, you have to identify the pulmonary trunk here. And I'm waiting for your answers. So what will be the your mind is saying? Pulmonary trunk will be the A, it will be here, or the B here, or the C will be here, or the D, it's here. I'm waiting for your answers. Please try to reply in the chat box. Whoever watching the list live session, please try to answer in the chat box. So it will be much better for understanding it. What will be the your answers? A, no. Dr. A will be the not the pulmonary trunk. He is asking you about the pulmonary trunk. What is he asking? He is asking you about the pulmonary trunk. Just before the answering it, I'm trying to explain you. Just check it out this image. Just check it out this image. Which A you are saying? This A, this notch which you are answering. This is not the pulmonary trunk. This is your aortic notch. What is it? This notch, which is the known as the A. They given the name is here A. This particular notch is known as your aortic notch. The aortic notch is the A. All right. The secondly, you can see here, this is getting out. This is your pulmonary trunk, which is given as a synonym, the B. Right. This is your pulmonary trunk. What is this? This is your pulmonary trunk. And the C1 was your left atrium, as it is below of it. So this will be your C, will be your left atrium. And the last one, which was the D, here, and it will be your right atrium. This will be your right atrium, right? So this can be as a radiological. Maybe they can ask you MCQ of the radiology, although they can ask you this question as per the anatomy also, as per the anatomy also, right? So this will be the your pulmonary trunk. So your answer should be here. You can see now. I think you can understand what is your A. Your A is your aortic notch. B is your pulmonary trunk. C is your left atrium, and the D is your right atrium. So pulmonary trunk, aortic notch, pulmonary trunk, aortic notch, left atrium, and the right atrium are mentioned in this particular image. So your answer should be here B. Okay, so your answer should be here B, right? So answer should be here B, and the B is your what? This was your pulmonary trunk. Just remember this image. Just remember this image. I already mentioned here in this particular PDF. Okay, particular this PDF, I mentioned this image, so you can check it out this in the later also, right? Maybe in the previous yearly question they asked about the pulmonary trunk. Maybe this time they can ask you about the aortic notch, or maybe about the atriums they can ask you, right? So you have to remember this all of stuff, that pulmonary aortic notch is the A, pulmonary trunk is the below the it, this notch is the aortic notch, and the below we have the pulmonary trunk, and the left atrium and the right atrium. Perfect. Okay. Now moving forward for the question number 14. And in this question, very good question framed here, that in a 55-year-old male, in a 55-year-old male who has been diagnosed with the left testicular carcinoma. The patient is having the left testicular carcinoma. which lymph nodes is typically affected first? So if I'm talking about it, if I'm converting this particular clinical based question into your one liner, so converting it to the one liner, it will be they are asking you that from the left testicular, the which lymph nodes are supplying it. Okay, so as the lymph nodes will be getting now, where we have to study lymph node will be studied in your anatomy subject only, and you already know the lymph node is making the metastasis in the carcinoma cases, right? So that's why they are asking you in which lymph node typically they will be affected the first. So the option is given: the inguinal lymph nodes, B is your para-aortic lymph nodes, C is your iliac lymph nodes, and the D is your paracervical lymph nodes. So what will be your answers, guys? I'm waiting for your answers in the chat box. I'm waiting for your everyone's answer. Please try to reply me in the chat box that if the person is having, if the person is having the, this patient is having the left testicular carcinoma, so which lymph nodes will be getting affected the first? Exactly, the answer should be here para-aortic lymph nodes. Your answer should be here B, para-aortic lymph nodes. And in this para-aortic lymph nodes, your answer should be here para-aortic lymph nodes. And now we are talking about this para-aortic lymph nodes. Please understand the thing. This para-aortic lymph nodes, exactly, this para-aortic lymph nodes, not the inguinal, guys, not the inguinal. Please understand the thing. I'm telling you why the para-aortic lymph nodes. This para-aortic lymph nodes are located near the aorta. That's why the name is given para-aortic. Yes or no? The para-aortic. And drain the lymphatic fluids from the testicles. They drain the lymphatic fluid from the testicle. And in the most of the case, the para-aortic lymph nodes are the first lymph node, which will be getting involvement into the testicular carcinoma, which will be getting involved in your testicular carcinoma. And with this will be getting spread to this nodes can occur even the smaller tumor, and spread to this nodes can even with small tumors also, right? So if I'm talking about the testicular lymph node supplies, yes, that will be your para-aortic lymph node. That will be your para-aortic lymph nodes, right? So remember this: the para-aortic lymph nodes will be your answer in the case of lymph node involvement of, in the case of your testicular, in the case of your testicular carcinoma, testicular carcinoma. All right, all right, okay. Moving forward for the next, and in this is also image based question, very good MCQ. Again, this is also question of your particularly from your brachial plexus. Which nerve can be damaged when the fracture of the sustain in the area marked with the red arrow in the image? So they are asking you the arrow. Yes, I am making an arrow. The arrow is here. This area is getting fractured. Okay, and they are asking you about the particularly about the nerve. The option is given: A, radial nerve, B, medial nerve, C, ulnar nerve, and the D will be your musculocutaneous nerve. Musculocutaneous nerve, right? So radial nerve, medial nerve, ulnar nerve, and the musculocutaneous nerve. I'm waiting for everyone's answer. Try to answer in the chat box. Try to answer in the chat box. What will be your answers? What will be your answers in this case? What will the answer in this case? Exactly. Very good, guys. Very good. And your answer should be here, ulnar nerve. Now, your mind is saying, why sir the ulnar nerve? Right? Yes, your answer will be your ulnar nerve. Now, understand the thing. Understand the thing. Why the ulnar nerve will be the answer? The ulnar nerve is the crossed behind the medial condyle. The ulnar nerve will be getting crossed the behind the medial epicondyle of the humerus. And as I shown you in the image, again I'm taking back to you image. I'm erasing it so it will be clearly visible to you. Can you see here where the mark the location? It will also marking the location at the your medial epicondyle of the humerus. Medial epicondyle of the humerus. And this, and in this case, you can see clearly there is a fracture, the particularly mentioned, the fracture of that particularly area. So the particular area will be fractured, the fractured of your medial epicondyle. So as your medial epicondyle will be getting, as your medial epicondyle will be getting injury, right? As your fracture of your medial epicondyle, this will be give the injury to your ulnar nerve. It will be give to your injury to your ulnar nerve. And as the ulnar nerve at the fraction carpi ulnaris can be result to the repetitive strain in the trauma or the condition of your cubital tunnel syndrome. Remember this particular topics where we're getting the involvement of your ulnar nerve in the cubital tunnel syndrome also, right? The symptoms can be included if you're talking about the symptoms of related to this. The symptoms will be here, including the pain, tingling in this the little fingers and the ring finger, right? In the little finger and the ring finger, the tingling will be the, and the hand or the wrist will be the weaken, and the difficulty into the fine motors like tasks like gripping the objects and everything, because the ulnar nerve will be getting damaged, so the patient cannot do the grabbing of here, and the this little fingers and your ring finger will be getting tingling sensation. This both of the fingers will be getting the tingling sensation and the pain will be in the head, right? So this will be the all symptoms of your fracture of your medial epicondyle. Medial epicondyle. Okay, doctors. All right. Let's move forward. Again, very important question from your tongue, right? Muscles of the tongue. And the question is asking here that what is structure marked in the image below? And you can see here the structure which is marked here, this particular muscle, this particular muscle. And the options are clearly given. A is your hyaloglossus, B is your styloglossus, C is your palatoglossus, and the D is your genioglossus. And I'm waiting for everyone's answer. This is a very, very, very important topic. Very important. Try to answer, guys. Try to answer which muscle you are seeing, which is the marked here. Very easy question. So this will be the answer should be here, your exactly, guys. Very good, very good, very impressive. The answer should be here, your genioglossus. The answer should be here, your genioglossus. And why the genioglossus? Please understand by this image, as it is originating from the upper genital tubercle of the mandible. This is the generating from where it will be getting innervating or the initiating the fibers which are originating from the upper genital tubercle of the mandible, and its upper fibers are insert into the tip of the tongue, the upper fibers. The middle fibers, if we're talking about the middle fibers, it insert into the dorsum of the tongue, and the last will be the lower fibers. Please understand the thing, insert into the your hyoid bone. Just checking out in this image, I am showing you one by one everything which is written in this image or the explanation. The upper fibers, you can see this will be your mandible, genital tubercle. From here, the fibers will be getting originated. The upper fibers are getting attached to your attached to your upper fibers are getting attached into the tip of the tongue, right? So you can see at the tip of the tongue, these fibers will be getting attachments. Okay, the middle fiber will be getting attachment. Your middle fiber will be getting attachment. Now you can see here your middle fibers will be getting attachment to your dorsum of the tongue. This will be going behind. You can see here this will be going behind and attached to your dorsum of the tongue, dorsum of the tongue, right? it will go behind and attach to your dorsum of the tongue. And the last one, which is the lower fibers. The lower fibers, you can see, it will be transmitting like here, and it will be going to attach to your hyoid bone. So it is having the three fibers: upper tip of the tongue, middle dorsum of the tongue, third lower, it will be attaching to your hyoid bone, right? So this three will be here. This three will be here, which is important from your tongue, importantly for the muscle of the genioglossus. And although, now remember this, what is the importance of it? They can ask you whatever the other things can they ask from this particular topic. This is also known as the, that's why it is also called as the safety muscle of the tongue. It is also known as your safety muscle of the tongue, right? So you can say safety muscle of the tongue. And as it is a safety muscle of the tongue, why it is known as the safety muscle of the tongue? Because it prevents the tongue from the falling backward into the respiratory tube, right? So this flapping behind, this tongue cannot go behind and block the your respiratory tube, which is your larynx, right? So it cannot block the larynx, right? So this is the making, this is the what is the main role of it? It is not going doing the it is not allowing to do this, the fall back of the tongue. And this is, that's why it is known as your safety muscle of the tongue, safety muscle of the tongue, right? So this is all about your genioglossus. This is all about your genioglossus muscle. Now moving forward for the next question, I hope you understand this particular about the tongues of the muscle. And the tongues of the muscle, the genioglossus is very important, right? In the image they asked you about the mark the particular muscle, and they asked you, they can ask you about the safety muscle also, like which is the safety muscle of the tongue. So you have to answer which is your genioglossus, which is your genioglossus. What will be the your answer in this particular question? The question is asking here, the question is asked here that on the palpation at the site which is marked at the red arrow in the image, sorry, in the black arrow, right? So I'm marking with the red, no issues. This one. So now on the palpation at the site marked with the red arrow on the image, a bony ridge is felt. Yes, a bony ridge is felt. What the vertebral level of this particular marked arrow? So that is asking you about the particular area, the vertebral area where we have the mark this arrow. All right. And this is a very important, very, very important. Try to answer, guys. I'm waiting for your answers. Try to answer, guys. Try to answers. The option is given here: T3, T4 intervertebral disc, T2, T3 intervertebral disc, T5, T6 intervertebral disc, and the T4, T5 intervertebral disc. So what will be the answers? Yes, your answer will be here D. T4, T5 intervertebral disc. Your answer will be here T4, T5 intervertebral disc. Why? Now understand the thing. If the bony ridge is filled, in the question is given, the bony ridge is filled during the palpation, right? In the location of the your, what the location of it? It is your suprasternal notch, right? It is your suprasternal notch. Okay, and the marked arrow, will be at the your T4, T5 interval disc level, and this will be going to represent, please understand the thing, this will be going to represent the also known as your angle of Lewis, angle of the Lewis, also known as the sternal angle, right? You know about the sternum, that is the sternal angle. Yes, that particular sternal angle and the angle of Lewis, right? So this particular image was which is shown there at the which level? Yes, T4, T5. And what is the clinical significance is there? What is the anatomical particular? Anatomically structures are there. This will be the angle of Lewis. Also, it is known as your sternal angle. Also known as your sternal angle. Right? Okay. Let's move forward. And this question is a little bit similar seen to you. The same kind of the X-ray. The same kind of the X-ray we saw in the starting. The same kind of X-ray we saw in the starting. But what we are doing, as we saw, this particular image, our mind is getting stuck, and just we understand that we learn that at the fracture of the shaft of the humerus, the radial nerve is getting damaged. What is the getting damaged? Radial nerve. But what is the mind? As you are pressurized in this, due to the pressure of the exam, you are sitting in the exam hall and you are seeing this particular MCQ in front of you. You are in the on the computer in front of your screen, and your mind is not reading the question, not seeing the options. What just you do? What just you do? It's a normal human tendency and the student tendency, right? As you saw the in the clinical X-ray, just now the doctor is also answering the wrong. Doctor, please read the particular MCQ clearly. That's why I put it this particular all the important previous year questions I compiled here, right? So this you will not repeat this mistakes there. You will not repeat this mistake there. Now perfect, right? Now perfect. So at the shaft, as the shaft will be getting damaged, as the shaft of the humerus will be getting damaged, there will be the radial nerve will be getting damaged. I agree with you exactly. But in this question, what is they asking? They're asking a patient is referred to the higher center with the diagnosis of the fracture. On the examination, the forearm pulses were not palpable. So on the forearm, the pulse will be not palpable. And the upper arm X-ray was done, which shown the given below. And what this is showing? Yes, it is showing us what? It is showing us the fracture of shaft of the humerus. It is showing us the fracture of the shaft of the humerus. And which artery? Now understand the thing. In the MCQ, they are asking which artery is the most likely to be injured in this condition. So they are asking about the artery, not about the nerve. Doctors who are answering in the chat box A, radial artery. No, it is not the radial artery. Now tell me, is the radial artery is in arm? Is the possible? It is the X-ray of arm. It is the X-ray of arm, right? Is the radial artery in the arm? The first thing I'm asking you, right? Whatever our student tendency, we are answering, and you are not seeing the options also. I agree with you. I'm also like you already, right? So if I saw the question in a hurry or in the pressurizing situation, I will also answer the radial artery. But here the question is asked the artery, not the nerve. If the nerve is asked, it will be your radial nerve. I'm writing here radial nerve. Okay, but there is asking, yes, now you are replying correct, doctors. They are asking the artery. So which artery will be there? Your artery at the level of the shaft of the humerus is your brachial artery. Which artery, guys? This will be your brachial artery, not the ulnar artery, not the radial artery. This will be your brachial artery, right? Now why the brachial artery? Let's understand the thing. Understand the thing. The brachial artery, now you will understand the thing, so you will not forget any now you will not forget this particular particular question, and you will remember this particularly. Please understand, the option A and B's cannot be the possible, never ever possible, because at the level of the arm, only and only brachial artery is there. The radial artery will be in the forearms, your ulnar artery will be also in the forearm. So this two will be the not possible. The radial artery and the ulnar artery will be the never ever possible. Okay. Now you can understand the thing. The brachial artery is the major artery of the upper arm. and runs along the anterior aspect of the arm and the main blood supply of the vessel that supplies blood to the arm. That supplies to the blood to the arm. And then further, now listen this part carefully. The brachial artery further divided into the radial artery and the ulnar artery in the elbow region, where your radial artery and ulnar artery will be getting now from the brachial artery, which is coming from your arm, and at the level of the elbow region, at the elbow region, your brachial artery will be getting divided or giving the two particular arteries, and this two particular artery is known as, it's known as, one is your radial artery, second is your ulnar artery. And the injury to the brachial artery, please understand, an injury to the brachial artery that can be reduce the blood flow into the entire arm, and including the forearm also and the hand also, because this brachial artery will be going to supply the ulnar and the radial. So there will be the pulse will be feel. What you're answering is saying, as the pulse is absent, you're answering the radial, not the radial. Okay. Now you understand, they are asking at the level of the arm. So at the level of the arm, the brachial will be the answer, right? And this can be cause the reduction or the absence of the pulses in the upper arm, right? So now you can understand the thing. If the fracture of the shaft of the humerus, the radial now can be damaged and the brachial artery. Which artery? Brachial artery. Okay, remember this very well, all right? And this is the more confusing question. They can mention you about the nerve. If they're asking about the nerve with the same x-ray, your answer should be radial nerve. If they're asking about the artery with the same x-ray, your answer should be brachial artery. Brachial artery. Perfect. अब तो नहीं होगा ना ये वाला क्वेश्चन गलत कभी भी, right? Okay, very good guys. Let's move forward for the question number 19. This is also the anatomical question, although we can go with the surgical question also. It is related to the surgery and anatomy. There will be the your infert and the external of the thyroid gland from the given the image. So from where will the interferon and the axon, the thyroid gland will be getting allowed. So the option is given, the option is the vertebra is given A, B, C, and D. And the option is given from where to where the thyroid gland will be getting, etc. So B to D, from here to here, B to D like this. And the option second is saying, B is saying A to C. This is your option B. So this is option A. This will be option B. I'm drawing with the now the black. I think black will be not visible to you. Drawing with the yellow or orange, so it will be clearly visible. The C is saying exactly A to D is the option C. And the last C to D, just this is your option D. Okay. So now what will be your answers, guys? Reply me in the chat box. Try to reply me in the chat box. What will be your answers in this case? What will be your answers? Very good. Very good. Okay. So answer should be here. Your answer should be here. Yes. Your answer should be here. C. From A to D. From starting from A, it's action till the D. Right? So your thyroid, the interferon and the action of the thyroid gland from the given image, it is from your A to D. And now your mind is saying, so what is the A, what is the B, and what is the C? Let's talk about it. The answer should be your A to D. And if I'm talking about all the structures one by one, your A is your C5, your B is your C6, your C is your C7, and D is your T1. So let's mark with me. So you will never ever forget this particular image. And by this, you can image, by just the image, you can also understand. You can see this is the C7, right? This is the long process of the C7. So this C is your C7. This B is your C6 and A is your C5 and the D is your T1. This is your T1, right? Understood? Right? So this is a clinical feature to understanding this particular uh, for the particular bony image. So you can just see this is the long process, right? And this will be your C7 vertebra, right? C7 vertebrae. So this is the C7, above the C6, C5, and this below one more is the your T1. And now you already know that your thyroid gland is situated in the front of the neck. The thyroid gland is situated in the front of the neck and below the larynx between the your C5 to T1 vertebrae. From where it will be getting situated? It's situating between your C5 to T1. So that's why in the MCQ, they mentioned the C5, which was the A, B was your C6, C was your C7, and the D is your T1. T1, right? So the clinical image, I think it is an image of your, you can say that this is the image of the radiological MCQ. Yes, I can agree with you. But the anatomical, the question related to this, showing this image, the X-ray image, they are asking you the anatomical question. Okay. Should we move forward? Okay. Moving forward for the next question number 20. A woman present with the sudden onset of the dysphagia. Please try to find the key points. If you find the key points, it will be much better for you to understand the question. Understand the question. So mark with me when I'm telling you, I'm giving the solving of the MCQ trick also. So try to find the key point. Okay, so dysphagia is there. Also, the patient is having the dysarthria. Second key point. The third, the patient is having the gait ataxia. Patient is having the gait ataxia. And on the MRI, it reveals an acute infarct. On the MRI, it's revealed the acute infarct in the right dorsolateral medulla. What is it showing? It is showing at the right dorsolateral medulla. What will be your diagnosis? This is the location, fourth. So this is the 4 key points are given in this particular MCQ. And now tell me what will be your answer? What will be your answer? Very good, doctors. Very good. It will be your Wallenberg syndrome. What will be the answers? Your answer should be your Wallenberg syndrome. What is the Wallenberg syndrome? Let's talk about the syndrome. This is a rare condition. This is a rare condition. And this rare condition from the damage of the lower part of the brain stem. As you now understand, in the clinical MCQ only they mentioned, in the clinical MCQ mentioned the right dorsal medulla. Right dorsal medulla will be getting affected due to the acute infarct. And it is the lower part of the brainstem, right? And in this kind of the particular patient where the Wallenberg syndrome, the patient is having the symptoms of paralysis of the muscle of the chewing, swallowing, and the speaking. So that's why the patient has the muscles of the paralysis of your chewing, swallowing, and the speaking. The patient is having the dysarthria and dysphagia also, right? So in the mentioned dysphagia, dysarthria, and also in the gait ataxia, right? And this will be the different from the your. This is the different from your Wallenberg syndrome, which involves your dorsal medullary special. Okay, so that's why it is also the important. This is going to involvement of what? It is going to involvement of your dorsal medulla, right? So this is the question of your Wallenberg syndrome. Wallenberg syndrome, right? So what is the likely diagnosis of this particular patient? Wallenberg syndrome. Remember this clinical MCQ, Wallenberg syndrome. Talking about the again, this is also your question from your embryologically. As I already told you, one question from the embryological topic. From the embryology topic, one question surely will be there. Surely will be there. Okay, let's talk about it. Question number 21. A newborn had the hypoplasia of the mandible and the zygomatic bone. So a newborn is there who had the hypoplasia of the mandible and the zygomatic bone. If we're talking about it, there is a malformation of the axonal ears and the having the slanted palpebral fissures. The abnormality in which development of the following pharyngeal arches will be the most likely to indicate the condition. So in the particular condition, what you are finding, the patient is having the hypoplasia of the mandibles and the zygomatic bone. Also, there's a malformation will be seen in the axonal ears and having the slanted palpebral fissures. So what will be your mind is saying? What is the answer should be here? The option is given here: pharyngeal arch 1, pharyngeal arch 2, pharyngeal arch 3, and the pharyngeal arch 4. What will be your answers, guys? What will be the answers from your side? Which pharyngeal arch? Try to reply who are watching the live, right? I can see the many of the students are watching the live but not replying in the chat box. Just try to reply in the chat box, guys. Right? What will be the answer? Yes, your answer will be first pharyngeal arch. Your pharyngeal arch 1 will be your correct answer. Why the first arch will be here? Now understand the thing I already told you. The embryology is a very important topic. The one particular MCQ will be coming from your embryological topic. The first pharyngeal arch is also known as your mandibular arch. And that's why in the starting of the MCQ, they mentioned that the patient is having the mandibular and the zygomatic bone formation, malformation. And there is in the crucial situation is the embryological development. It is forming the part of the head and the neck region. It gives to rise the various structure like our essential formation of the face and neck, and the defects in the development of this arch can result into the condition called as the mandibulofacial dystrosis, or also known as your teacher's Collins syndrome. Teacher's Collins syndrome, and it is a characterizing of the same feature which is described in the scenario. Like the patient, what is the having? The patient is having the malformation of axonal ear, stunted palpebral fissures, and there is the hypoplasia of the mandible and the zygomatic bone. So your answer should be here first pharyngeal arch. Your answer should be here first pharyngeal arch. Right? Very good. Moving forward, this is also the question is related to your anatomy, and although you can say it's related to your radiological image as the image is given to you. And now what you have to do, please identify the structure which is indicated in this image below, and this structure is indicated here. Please try to answer me what structure you are seeing in this. What structure you are seeing? A, midbrain, B, pons, C, medulla oblongata, and D is your spinal cord. Try to reply. Very good question. Neurological question भी बोल सकते हैं इसको, but related to the anatomy is there. And what will be the answer? What is this structure here? What is this structure? I'm waiting for everyone's, guys. Please try to reply. Please try to reply. Okay. When you guys are replying, it will be much better for, right? It's much better. Okay. Okay. So your answer should be here. Answer should be here B. Pons. The answer should be here. Pons. Right? Answer should be here. Pons. And The marked structure in the image is the pons, as it is visible on MRI and or the CT scan. As there is a large, what is there? There is a large bulge in the brain stem. What is there? How we can identify? Yes, there is a large, what we are seeing, there is a large enlargement on the this brain stem, and in the sagittal section, when we are taking the sagittal section, we are getting this particularly large bulge, and the pons may be appear as the larger and the oval shaped structure located below the midbrain and above the medulla oblongata. So above, this is just below the pons, is below, situated just below the midbrain and above the medulla oblongata. So you can see this dilation. This dilation is your pons. Okay, this is structure is your pons. Okay, very good, very good. Let's move forward for the question number 23rd. A patient underwent the left submandibular gland excision. So the patient is removed what? The patient is had removed with the left submandibular, right? During this, during which of the hypoglossal nerve was damaged, injured? Which of the following deficit would seen in this case? The what is the happening? Due to this, there will be what happened during this? There is a hypoglossal. The hypoglossal nerve is getting damaged, and now tell me what will be the scene in this case as the hypoglossal. If I'm converting this particular clinical case scenario in the one liner, what the particular in this question examiner want to ask you, the examiner want to ask you that if hypoglossal nerve is injured, what will be the scene? What will be the clinically seen? So option A is given. There will be a diverted tongue to the contralateral side. The B is diverted tongue into the same side. The C is saying inability to protrude the tongue. And the D is saying loss of the taste in the posterior one third of the tongue. If we talked about the anterior one third, right? In the anterior one third, we talked about it, right? We talked about the anterior one third sensory supply and the all the supplies in the starting of the question, right? But if I'm talking about this, what will be your answer? Sir, I joined late. How many questions are left? We'll talk about the more all the important PYQs. Just go with this session. It will be helpful for your in your exam preparation, right? Doctor, okay, doctor. All right. We'll have to the more MCQs, right? Just continue with this session, okay? So your answer will be here. The answer will be here. B. There will be the diverted tongue to the same side. In this case, what will be the scene? Yes, in this case, we'll see the diverted tongue to the same side. And if I'm talking about it, now understand this thing. Now understand this thing. The hypoglossal nerve innervates the tongue muscles, including the extrinsic muscle and the intrinsic muscles. Injury during this submandibular gland excision can be lead to the weakening or the paralysis on the same side. Please understand, on the same side, because it will be injured here. So maybe on the left side or maybe the right side, there, which side will be there? The same side will be getting the weakness. If we're talking about it, this will be the causing the tongue to diverted towards the side when protruded. And this happens because of the hypoglossal nerve supply the most of the tongue muscles on the same side, leading imbalance in the muscle function, and the deviation may be substitute or the quite noticeable depending on the severity of the injury. So your answer should be in this case, what should be your answer? The diverted tongue to the same side. The tongue will be getting diverted to the same side, right? So this was your PYQ. Now coming for the important thing, that is your shoulder region. Always and always the one question from your shoulder region will be there in your exam, right? So in this question, they are asking what is the function of the muscle indicated in the provided image. So what will be the function in this? What is the function of this particular muscle indicated in this particular provided image? And this is your muscle. Now, I want to ask you guys if anyone can answer name of this muscle. Then we'll talk about the function of this muscle. Just tell me name of this muscle. Anyone of you can answer the name of the particular muscle? Doctors, I'm asking you the muscle name. Deltoid? Are you sure, doctor? Are you sure, doctor? It will be the deltoid. Option A is given here. They ask the indicated functions, right? So the option A is given retraction of the scapula. Option B is your protection of the scapula. Option C is your abduction of the shoulder joint, and option D is your adduction of the shoulder joint. Of course, you are answering correct, doctor. The answer should be your abduction of the shoulder joint will be done by this particular muscle. But my question is here, I'm asking you, can you name this muscle? From any one of you can name this muscle? Who all are watching live, guys, please try to answer. Please try to answer this question. Yes, answer will be the abduction of the shoulder joint. But my question is here, I'm asking you to hear that which muscle is that? Which muscle is that? Can you name the muscle? Any one of you? I'm waiting for your answers, guys. Okay. So very good. Very good. I got the answer. I got the answer. Yes. Yes. Exactly. Now you understand by the answering of it, right? The abduction is done by the your. Yes. Yeah. The muscle is marked here is your supraspinatus. Very good, doctor. Very good. Impressive. Supraspinatus muscle. And this supraspinatus muscle, which is marked there, which of the following about the spine, right? It is present above the spine of the scapula and help in the abduction the shoulder joint. And the muscle involved in the abduction of the shoulder joint are the deltoid, supraspinatus, and the trapezius muscle. I hope you remember with the when you're done with the rapid revision, you remember with the your abduction of the shoulder joint from 0 to 15 degree, then 15 to 90, and about this 90. Right? I hope you remember this. I hope you remember this. Right? Very good. Very good. So this will be helping in the abduction. This is your supraspinatus muscle. As it is just above the spine, right? Above the spine, this is your supraspinatus muscle. Very good. Moving forward for the next question. What is the vertebral level of the abdomen plane, which is labeled number 2? So this is the asking about this label number 2. I'm marking with the red color. I'm marking with the red color, drawing a line here. This was the label number 2. And they are asking you about the what is the vertebral level. So what will be the your answer, guys, in this case? What will be the your answer in this particular case? What is the vertebral level at this particular line? Anyone try to answer? All are just watching this session, not answering. Just try to answer, guys. If wrong, no issues. Okay. If you are getting wrong, you will be getting corrected for the exam purpose. If you are not replying here, right, and you will going to make mistakes in the exam, it will be more dangerous, right? More severe thing. So try to answer in this. Try to answer in this session. Right? Okay. Okay. So the answer will be here C. This will be at the upper border of the L3. What will be the location here? Yes, this will be the upper border of L3. And now, what is the mean of this upper level of L3? Now, please understand the thing. The abdominal plane, which is labeled by the 2, is your subcostal plane. On the subcostal plane is also known as your plane of superior mesenteric artery. The plane of superior mesenteric artery, right? And the subcostal plane at the horizontal plane location between the costal margin, which is going to connecting your 10th intercostal cartilage on the both right and the left side on the 10th intercostal 10th intercostal cartilage. The costal cartilage will be getting attached, right? And the posterior aspect of the body, if I'm talking about the posterior aspect of the body, the subcostal plane correspond to the level of the body of the upper border of third lumbar. This your subcostal plane is corresponding in the posteriorly. If I'm talking about the posterior side, it will be going to supporting us the which level? At the level of the vertebra, third lumbar vertebra will be there, right? And please now understand the thing. This plane inserts the aorta, the inferior vena cava, and the third part of the duodenum. And the third part of your duodenum, right? So at level of the L3, this having what we have the subcostal plane. In the subcostal plane, right? This is also known as the plane of superior mesenteric artery. This is also known as your plane of superior mesenteric artery, right? So now you will remember. Now you will remember always, right? Very good. Very good. Sure, doctor. I will make the important vertebral mark locations. I hope you had in the rapid revision. If you not, I will mark in the later part. Okay. I will give you the particular image or the particular landmarks of on the every vertebrals. Okay. Right. If you have any queries in the after this session also, maybe you have the query related to the any MCQ related to this particularly. So you can guys directly contact me on my both of the social media. You can directly contact me on the Instagram. My Instagram handle is the dr.Vaibhav Ahuja, right? So you can follow me on the Instagram, or you can ask if you have any queries, you can directly DM me. There, I will surely try to reply you as soon as possible there. If nowadays in your you are not using the Instagram and you want to ask me on the Telegram also, so my Telegram channel or my Telegram personal handle is username is my that dr Vaibhav Ahuja. The dot is not there. Okay, just difference between the both of the handle. The Instagram is having this particular dot. Okay, dr dot Vaibhav Ahuja, and my Telegram channel, the Telegram personal user name, the Telegram handle is the dr Vaibhav Ahuja, right? So you guys can contact me on my Instagram or my Telegram. I will surely try to reply your queries as soon as possible, right? Okay, guys. Okay, okay. Let's follow me on the Instagram, right? We'll solve more MCQs there also, right? Daily. Starting with the question number 26. Starting with the now question number 26. Which among the following aids is the supination and the pronation of the forearm? About the next session, follow me on my Instagram and follow the Madu Hub channel also, right? So you will get the particular information related to this sessions, about the sessions. Okay, when will be the next session? It will be informed you on the Instagram only, right? And surely soon will provide you the all the schedule also. Just wait for it. Surely will provide you the schedule also of this all the previous year question session. Okay, so it will be helpful for you to managing it, that you will revise the subject before coming to this previous year question session. All right. So I will request to the team. The team will be surely provide you. The team will surely provide you the particular schedule of this particular session. Okay, guys. Right. So, which among of this following the aids the supination and pronation of the forearm? So it is asked at the level of the forearm, and they are asking you about the movement of the supination and the pronation, and they are asking related to the joints. Please understand the thing. They are asking related to the joints. So in the joints, they are given the option. The A is your pivot joint. B is your saddle joint, C is your ipsiloid joint, and D is your ball and socket joint. And I hope you know very well for about your joints. And yes, it is your pivot joint. Your answer will be here, your pivot joint. What the pivot joint? Please understand the thing as the forearm, which is the radius and the ulna. And the forearm, your radius and ulna bones are connected at the elbow joint. Connected at the which joint? Yes, at the elbow joint. At the upper arm, which is the humerus bone. So radio and ulnar will be getting attached in the elbow joint to your humerus bone. And this joint will be follow the rotational movements. This joint is doing the having the rotational movement like supination and the pronation. Supination, pronation, supination, pronation, supination, pronation. And the supination pronation is the at the the radius rotate around the stationary ulna, and it is a pivot joint, right? It is the your pivot joint, right? This pivot joint is permitting the movement around in the single axis, supported by the ligaments and the muscles for the stability and the control of the motion and the reach. All right. So now you understand your movements of the forearm, which is the supination and the pronation. The supination and the pronation is done by the your which joint? Pivot joint. Pivot joint. Oh, very good. Now moving forward, and I think who joined the session from the starting and is still here. I already told you. I already told you very well about this anatomical snuff box. And as I told you about the anatomical snuff box, now the question is asked here that identify the anatomical structure, which is the anatomical structure marked in the given image. So this is the anatomical snuff box, and they marked this particular thing. And now my question is to you. Please try to answer. Please try to answer this particular particular structure. This is your anatomical snub box, and asked related to the anatomical snub box boundary. And in the starting only, I given you the anatomical snub box about the related to all the important things related to the anatomical snub box. Very well. I'm waiting for your answers, guys. I'm waiting for your answers. Just only one student is answering here, right? Many of you are watching the live and just not replying the answer. Try to reply. Try to reply the answer. I'm waiting for your answer. I'm giving you 10 seconds. What will be your answers, guys? Okay, I think you forgot about it. Let's talk about it. Yes, it will be your answer is your EPL. We talked about the EPL. Now tell me, EPL was on the lateral side or the medial side? The EPL was on the lateral side or the medial side. Let's check it out in this image. I already told you on the EPL. This EPL we have on the medial side. On the lateral side, we have the two. On the lateral side, what we have two? We have the EPB and the APL. APL, right? So answer, they asked you which is just on the medial side of it. And now you are thinking, sir, it's not the medial as the image is shown. As this image is shown like that, so this is not looking the medially. But please understand the thing, always and always our anatomical position is what? Our anatomical position is like that. Yes or no? So this will be our anatomical position. So medially it will be the inside. Yes, so it will be inside this side, right? So this will be the medially and this will be the laterally, right? So this will be our anatomical position. I hope you saw as the anatomy book BD Chorosia. What will be the position? Always and always like that. This hands will be like that, and the straight will be the position. This will be the anatomical position, right? So on the medial side, we have the extensor pollice longus. What we have? We have the EPL on the medial side, and what we have on the lateral side? Yes, on the lateral side we have the EPB, and we have the APL. APL. Very good, right? So I think now you do not forget this pointed structure which is shown in the image. It is your medial boundary. So we talked about the medial boundary. So in the medial boundary of the anatomical snub box, what is the form of it? Right? It is formed by your extensor pollice longus muscle. EPL. Remember this. Okay. Very, very important topic. Very important topic. Asked many times in the exams. Again and again coming the anatomical snub box related to this. And related to the anatomical snub box muscles, I already talked about it. About the base of it, the scaphoid bone is getting fractured. About the important structure which is passing throughout this particularly anatomical snub box. This is your radial artery. This is your radial artery, right? So I think now it will be clear to you. Now it will be clear to you, right? So this will be the your related to your anatomical snub box. Okay, let's move forward. Now we are talking about the next question. In this next question is also the image based question. And in this question we are asking about is which of the following arteries is palpable in this image shown below. Which artery can be palpable here? And you can see is the location. It is just near the shin. And the option is given anterior tibial artery, posterior tibial artery, and the popliteal artery. Now I'm waiting for your answers. Now I'm waiting for your answers. What will be the your answers here? What will be the your answer here? Which artery is palpable in this image particularly? And this question, please understand, this question came 2 times in your FMG exam and 1 time repeated in this NEET PG exam. So totally 3 times. So most probably it can repeat again in this exam also. So try to answer. Try to answer. Yes, try to answer, guys. I'm waiting for your answers. Which which artery will be getting palpable here? Your answer will be B. Posterior tibial artery. Let's talk about it. Let's talk about it. Why the answer is your posterior tibial artery? Who answered B is very good. Now understand the thing. The artery which is palpable in the image is shown. It is your posterior tibial artery. And it is palpable. Where will be going to palpate it? It is palpable between the medial malleolus and the Arches tendon, or you can say the tendinocalculus. You can say the tendinocalculus. So the location of it between the your medial malleolus and your tendinocalculus. Between this, if you are palpating the location of the passing, right, and the location of the medial malleolus, this is the bony hump. What is this? This is a bony hump on the side of the ankle. So you can see this will be the your this will be your bony hump is your medial malleolus. This is your bony hump is your medial malleolus, right? And the place you index and the middle, when you place your index and the middle fingers on the inside of the ankle and move your fingers behind the medial malleolus towards the back of the leg, you should be able to feel. You should be able to feel the posterior tibial artery pulsation in this area. So as the image is shown to you, now remember this, this is your medial malleolus. Near the medial malleolus, this is the tendinocalculus, right? Tendinocalculus, right? Or the Achilles tendon, you can say also. And this space, this particular space, if you are putting your index finger and you are feeling the pulsation there, this will be your posterior tibial artery. What you are feeling? Which artery palpation you are feeling? This is your posterior, which artery? Posterior tibial artery, right? Let's move forward. Let's move forward. And this is also important question. Twice repeated in FMG exam. Two times it's repeated in your FMG exam. If we're talking about this particular, if we're talking about the particular this question, they're asking you about the identify the type of joint given this image. So what is the joint they are asking? They're asking about this joint. And what is this joint? Yeah, this is the joint between the radio and the ulnar, between these two bones. So you can say the radio-ulnar joint. They're asking about the radio-ulnar joint, and maybe in the directly they can ask as the image also. Identify this joint. So the joint between the radio and the ulnar, which type of the joint is it? So the option is giving, which is the confusion. The main confusion is the options, because they're given symphysis A, B is your syndesmosis, C is your synchydrosis, and D is your synostosis. Right? So the option is given is the confusing. You remember something related to the sin. We studied the anatomy, right? Most of you are reading the anatomy because it's seems difficult, right? It seems difficult, and you are thinking about it, how to read this so much content of the anatomy and like that, right? I think in your profs, in the starting of your college, the profs you didn't read or well studied the base of the anatomy, like the BD Chaurasia, right? You didn't study more better. If you read that, so the anatomy will become easier for you, right? But I can understand. And now at this point of the time when you're reading this anatomy, so you remember something that related to the sin, but now the examiner want to try to confuse you. As examiner want to try to confuse you, they make the all the option like with the sin, right? You can see sy sin, and we are getting confused. But remember, please, the type of the joints. In the type of the joints, we have only syndesmosis. Syndesmosis. So answer between the radio-ulnar joint. If they are asking you the joint between the radio and the ulnar bone, or you can ask as a directly radio-ulnar joint, is your syndesmosis. Syndesmosis is the joint, right? So talking about this, what is this? Yes. So radio-ulnar joint, which is formed with the interosseous ligament. This type of the fibrous joint is known as your syndesmosis joint. Syndesmosis joint. And this syndesmosis is the type of the joint. There is a form of the union two bones by the strong fibrous tissues called as the ligament. And this type of the joint is found in the areas where the stability is the more important and the mobility is also, such as the distal tibiofibular joint, or the ankle and the distal radio-ulnar joint at the wrist, right? So what we need, there we need the they will need the stability also, and also we need the mobility also, all right? So this is about your syndesmosis. Don't forget about this syndesmosis, syndesmosis type of the joint. So 2 to 3 times they asked directly, and one time this previous year question they asked them with the image, and once they directly asked name of the joint between the radio and the ulnar, right? Joint between the radius and ulnar. Name that particular joint which is between your radius and the ulnar, right? So you have to remember this. Talking about the next question. The next question is here. After a fall from the height, with the hand is outstretched, a man is brought to the emergency department. An X-ray reveals the fracture of the clavicle, and which is the more specific region of the clavicle is most likely to be the fracture. So the question is related to your orthopedics or the anatomy. The question is directly want to ask you which is the most common fracture of the clavicle bone, right? Which structure of the clavicle bone is getting more fracture? So try to answer. Try to answer it. Try to answer it, guys. I'm waiting for your answers. Very good. Very good. As the clavicle fracture is coming in your exam, your mind should be altered and you can understand the thing. You can understand the thing. Sorry for the disturbance, guys. I think it was technical issue. Now I'm audible. I was trying to replying you, but on the other screen I'm seeing there is no audio. Now I'm audible. Am I audible now? Reply me in the chat box. Okay. Okay. Right. Okay. Now if I'm talking about it, in the question, what is the most likely fractured region? The region of the fractured is your, yes, the region of the fractured is your, the junction between the medial 2/3 and the lateral 1/3. Answer should be here A. Right? So answer should be here the medial 1/3, the junction of the medial. From the medial side, it is the 2/3, and from the lateral side, it is the 1/3. It will be the your junction of the fracture of the clavicle. At the junction of the medial 2/3 and the lateral 1/3 of the clavicle, the most common site of the clavicular fracture. This is the most common site. Please understand. Okay, so if the question is coming related to your clavicular fracture, you have to remember most common is your medial 2/3 and the lateral 1/3. Medial 2/3 and the lateral 1/3. Okay, and the according to it, the approximately the 80% of the all the clavicular fractures are in this junction only. Okay, so that's why this is known as the junction of it, or the known also known as the transitional zone. Also, it is known as the transitional zone, right? Because of it, where the clavicle getting the changes and a thicker, more rounded in the bone, thinner, and the flatter the bone. So this is your transitional zone or the junction where it is the 80% of the clavicle fracture are there. So please remember in the FMG exam, if they are asking you about the fracture, so they are asking you about the most common fracture. Don't go in the deep. Don't go in the deep, right? Just talk about it. If we're talking about it, just talk about the difference. Now, doctor is mentioning here the medial third, fifth, or the lateral 2/5. Yes. If what is the thing is here, if this is the thing, and you are making it the 5 section, so the medial 3 sections and the lateral 2 section. If I'm dividing this clavicle into the 3 parts, 1, 2, and the 3, so the 2/3, this 2 parts on the medial side and the 1 part on the lateral side, this will be the section. So now, if you are talking about the more deeper or the more fine, if I'm talking about the location of more fine location of it, so it will be here medial third, fifth, and the lateral 2/5. Okay. Okay, the same only. This will be the same. No any difference, right? Just to divide it the clavicle into the more parts. Okay, doctor? Okay. So this will be the same. Medial 2/3 and the lateral 1/3 will be there. Perfect. Moving forward, and this is also again the repetitively coming in your FMG exam. Very important, very important PYQ. And talking about this particular question, a patient with the leprosy, the patient with the leprosy presented with the deformity as shown the below. And you can see here what is the shown in this image. And they are asking you about the which nerve injury caused in this given condition. So they are asking you about the nerve, and the option is given the ulnar nerve, B is your median nerve, B is your radial nerve, and C is your median nerve, and D is your posterior interosseous nerve. I'm waiting for your answers. Can anyone of you can tell me what is this clinical deformity? Name of this particular clinical deformity? Anyone of you? Can anyone of you can give me this particular name of this particular deformity? Right? Try to answer. Try to answer. I'm waiting for your answers, guys. Okay. Partial claw hand, very good. Incomplete claw hand, half claw hand can claw hand will be not shut. Claw hand कैसा होगा? पूरा claw हो जाएगा. Okay, this will be the claw hand. Partially claw hand. Exactly, it will be looking like that. It will be looking like that. And I hope you know about the remembering the supply of it. This three digits will be getting supply from your this three digits will be getting supply from your radial nerve, and this two digits are getting supply from your ulnar nerve. This two will be getting from your ulnar nerve, and the answer will be here if the ulnar nerve is getting damaged in the laprocy. Although you know the laprocy is involving the ulnar nerve, the two things will be here as a clinical vintage is given. I agree with it. Although we are talking about it, we are talking about the particularly about the your particularly talking about the your particularly we are talking about the your partial claw hand, right? Yeah, point index, very good. Pointing index is also same, right? So this will be the your ulnar nerve. This will be the your ulnar nerve. Just a minute, guys. Sorry for the disturbance. Just a minute. I think this covered or not? Yes. So this will be the your ulnar nerve. Now perfect. Okay. So this will be the your ulnar nerve, right? Why the ulnar nerve will be there? If I'm talking about this particular image, if I'm talking about this particular image, on the ulnar nerve, it's injured at the elbow, the flexion carpis ulnaris, and the medial half of this flexor is known as your flexor digitorum profundus are paralyzed. And due to this paralysis of it, the medial border of the forearm becomes flattened and attempt to produce the flexion at the wrist result. In the abduction of the hand, the tendon will be getting the flexor carpi ulnaris does not tighten to make the fist, and this tendon is the terminal phalanges of the ring and the little finger is lost. And due to this, you know, this will be known as the partial claw hand. Partial claw hand. Partial claw hand. Right? Okay. Let's move forward. Let's move forward for the next question, the question number 32. Identify the tarsal bone. Identify the tarsal bone which is labeled in the image below. And you can see here, they've labeled a bone here. They labeled the bone here. Now I'm waiting for your answers. This is a very important 2 to 3 times asked in your FMG exam. All the important. You are thinking like that. I'm every question I'm saying the this is the repeated. Yes, I have take all the important questions which is repeated again and again in the FMG. Very good. The option is here: calcaneus, B cuboid, C navicular, and the D talus. Your answer is here navicular. The answer of here is your navicular. Navicular. And if I'm talking about this, this is the dorsoplantar view, which you can see of the particular X-ray image. This is a what? This is your dorsoplantar view of the ankle. And this dorsoplantar view of the ankle and the foot, which shown is the navicular bone. Shown to you, it is the your navicular bone, right? The navicular bone is a boat shaped and it is situated into your medial side of the foot, in front of the head of the talus and the behind the three cuneiform bones. Anatomical positioning, it held the mediolateral according to its side. So what we are seeing? We are seeing in this image, that this is the your X-ray image, which is the X-ray image. This is your dorsoplantar. This is your dorsoplantar view. And due to this dorsoplantar view, we are seeing in the foot there is the navicular bone, right? This is the your navicular bone, right? Let's move forward. Just a minute, guys. Again and again, this is coming on the screen, right? Just can you give me 1 minute, please? I'm trying to. This screen is getting again this marks. Just give me a minute. I will try to. I will try to sort this problem. Just a minute. I hope you guys are enjoying this sessions, right? As you already studied the anatomy well, so now solving the MCQs will be much interested for you. All right, much interested for you. Okay, I think now it's perfect. Okay, the screen is clearly visible to you now, guys. Let me know in the chat box. Is the screen is visible? Right. Okay. Perfect. Sorry for this disturbance. There was some technical issue was there. Uh, Sorry for it. Right. Let's start. Let's start again. And starting with the question again. This is also the question with the your again the question is from which again the question is from your embryological, and a newborn presented into the your NICU, newborn ICU will be there, right, with the respiratory distress and the meconium discharge from the umbilicus. Now the two things will be given. The first clinical will be the respiratory distress. The patient is under the respiratory distress. And the second is saying that the meconium is getting discharged from the umbilicus. The condition is due to the patency of which structure. So this is also the embryological, right? And the option is given here. The option is given here. Mesonephric duct. B is your allantois. C is your urcus, and B is your Valentine fistula. Now, my question to you: try to answer in the your try to answer in your chat box. What will be the your answer? What will be the your answer in this particular case? What will be the your answer? Try to answer. Try to answer. Everyone, try to answer it. I'm waiting for your answers. It will be much interactive when you are answering the questions. It will be much interested for me to teach you also. It will be not the allantois. Please understand the thing. It will be the your Valentine fistula. What is it? It will be your Valentine fistula. Now, talking about this Valentine fistula, what is the Valentine fistula? Please understand the thing. By the seventh week, by the seventh week of the development of in the vitelline duct is the completely obligated, and the regress into the umbilical cord, and it will regress into the umbilical cord. And what will be happen with this? There is the remnants of there will be the remnants of the intestinal duct. There will be the remnants of the intestinal duct, right? May from the tumors at the umbilicus, which is known as your raspberry red tumors or the cherry red tumor. आप लोगों ने देखा होगा, right? And the persistence of this patent intestinal duct can be result in the your fecal fistula at the umbilicus. Can be result into the your fecal fistula in the umbilicus. Doctor, no need to worry about it. If you are getting wrong the answer here, please understand the thing. आप लोग यहाँ गलती कर रहे हैं, कोई बड़ी बात नहीं है. Now you understand this topic. Now you understand about this well intestinal duct very well. So if in the next time or in this exam the question is coming to this particular topic, you will definitely you will get corrected this answer. All right. So that's why I'm saying to you, try to answer. Every time I'm saying to you, please try to answer the questions in the chat box. All right. Okay. The next, the related to your obs and gynae and the anatomy question. The question is related to the both of the subject. Identify the structure marked in the diagram shown in the development of the ovarian follicle. They are asking you about this particular follicle. Which type of this follicle is there? A, it is a primary follicle. B, is this the anternal follicle? C, it is a primordial follicle. And the D is the corpus luteum. Corpus luteum. And it's much interested topic from the obs and gynae also. In the obs and gynae, in the physiology and anatomy, you are of the in the starting of the you are reading about this cycle, menstrual cycle. In the menstrual cycle, you are reading this about this follicles also. Try to answer, guys. What will be it? It will be the primary follicle. No. It will be the antral follicle. Exactly. Everyone is replying very well. Very good. Very good, guys. It will be the your antral follicle. It will involve what? It will be your antral follicles. And you already know what is the antral follicle. The secondary follicle is also known as your antral follicle. Yes, your secondary follicle is also known as your antral follicle. As the meiosis progress with the oocyte, the primary follicle will mature into the secondary follicle, which then develop into the antral follicle. Then which will develop into the antral follicle, and the antral follicle eventually transform into a mature follicle. Also, it's referred to as a Graafian follicle or known as the tertiary follicles. Right. So the stage which was marked there, this stage which is marked there, this is your antral follicle. This is your antral follicle. Right. Now, question number 35. Please understand the thing. This is the PYQ from your FMG 2022, right? And in the FMG 2022, they asked this type of the question. Mostly, this is the type of a INI seat level question. If I'm talking about it, the generally I'm talking about it. This type of the questions are asked in your INI set. कहाँ पूछे जाते हैं? INI set में. But as I saw this question in your FMG, it was a little bit difficult, but I don't think so that you cannot answer this. I cannot think that you cannot answer that. What is the mentioned here? This is the one. The first is mentioned here. I am again drawing it. The 2 is here, 3 is here, and the 4 is here. And they are asking about the location of this particular auscultations area from the heart. And I hope you know about the auscultation areas very well. I hope you know about your auscultations areas very well. So starting with the first of all, just taking with the A. What I'm seeing, first of all, I'm seeing only and only the one of only. The first I have to see the A. What is the A? Can you tell me what is the A? What is the A? What is the A is here? This one. One is what? Mitral aortic what? It will be the your mitral or aortic. Just try to answer me. All physicians take money. Very good. Very good. This will be the I'm going to tell you in the late part. But you started with the doctor started with the only the mnemonic. Okay. He tried to answer with the mnemonic only. Okay. So the A is your aortic. Very good. So A is the aortic. First one is the your aortic. Very good. Just opposite of the aortic, we have the pulmonary trunk. Just opposite of this aortic auscultation, we have the pulmonary trunk. So from the pulmonary trunk, we are getting the pulmonary auscultation point. So D is your pulmonary. Now I'm checking in that the option D will be not because aortic and tricuspid. Option C will be not because it will be the mitral and the pulmonary is mentioned there. Now option A is also having the first is the aortic, correct. Second is the pulmonary in the both. Now we have to decide it with the mitral wall and the tricuspid wall, that it is the which type of the auscultation will be there. And just please understand the one thing, the metal valve is listened at the apex, and apex is on the fourth. So metal valve will be at the fourth. And with this, we solve the answer. The answer should be here B. What will be your answer? Yes, your answer will be B. The first will be the aortic, second will be the pulmonary, then the tricuspid will be there, and on the apex we are hearing on the auscultation what we are hearing on the apex. Beat will be the your mitral wall, right? What we are listening? We are listening the mitral wall, and this is about your auscultation, right? So remember this: the first, which was the aortic wall, which is the second right intercostal near the sternum. It will be seen on the right side. Please remember, the right side only the one auscultation will be there, right? On the second right intercostal, on the second right costal cartilage, we'll see near the sternum. We are listening what? We are listening the aortic wall. Aortic wall. Next, we have the pulmonary wall. Where is the pulmonary wall? The pulmonary wall just opposite of the aortic wall. It will be in the second intercostal, in the left side of the sternum, on the left side of the sternum. And the talking about the third, the tricuspid wall, it will be the lower end of the sternum. It will be at the lower end of the sternum, and your mitral wall. As I already told you, how we identify between the A and B? Yes, we identify with the cardiac apex, because on the cardiac apex we have the mitral wall. And now, how to remember this? How to remember this? How to remember this? Of course, this will be your APTM, right? APTM. Or also, you can divide as the all physician take money, right? All physicians take the money. This will be the mnemonic for you. You can remember with the short mnemonic APTM, or you can remember with the full mnemonic, which is your all physicians take money. This will be the your mnemonic for your auscultation. This will be the mnemonic for your auscultation of heart. Right? Talking about the question number 36. The image which is shown in the cross section of the trachea identify the structure which is marked, and they asked this particular mark this structure. Now I'm waiting for your answers in the chat box. Try to reply what will be your answer from your side. Try to answer. What will be your answer? A, trachealis muscle. B, tracheal cartilage. C, esophageal submucosal gland. And D is your perichondrium. Very good. Very good, guys. This is will be your, as you can see, this is the muscular structure. Not will be the cartilage, right? And this will be your trachealis muscle, right? So the answer will be here, your trachealis muscles. I think there is no need of the explanation, but I think you can understand this thing. There's a trachealis muscle is a thick band of the smooth muscle bridge. That bridge at the end of the each of the horseshoe shaped tracheal rings, and that will be help to stabilize what? That will be help to stabilize the entire length of the windpipe. It will be going to help you in the helping in the making the entire length of this windpipe, right? Moving forward for the question number 37. What is the term is used to describe the vertical plane? Please understand, vertical plane that separates the body into the anterior and the posterior section. This is a very basic question from the anatomy. Guys, try to answer it. Guys, try to answer it. Which section will be there which separate the body into the anterior and the posterior part in the vertical plane? The question is there, the vertical plane they are asking, right? Option A is the coronal plane. Option B is the transfer plane. Option C is the axial plane. And option D is the median plane. And Very good, guys. Very good. Your answer will be the coronal plane. If I'm talking about the coronal plane, yes, the coronal plane. What will be happening in the coronal plane? I can give you the example of this particular section. In this sections, you can understand which plane is dividing in which part. So you can see the first one is your coronal plane, or also known as the frontal plane. This purpose, it is dividing you the vertically the body into the anterior and the posterior part. The second one, we have the horizontal axis or the transfer axis plane, which we can divide it the body into the upper and the lower part, right? Upper and the lower of the part. Perfect. And then we have the sagittal and the longitudinal plane. We have the sagittal and the longitudinal plane, which is also known as the transfer plane, median plane, right? This will be your median plane. And the last we have the parasagittal plane. Last we have the parasagittal. By this image, you can understand about the all the types of planes which can be there, right? So in the question, they are asking you the person is can be divided. The anatomically we can divide it in the anterior and the posterior in the vertical section. So this will be your coronal plane. This will be your coronal plane, right? I hope you understand with this particular image only, right? Very good, very good. Let's move for the question number 38. The inner layer of the fallopian tube is covered by, again, anatomical question, although integrated with your obs and gynae. So now tell me, what will be your answers? What will be your answers? By this inner layer of the fallopian tube is covered by the which type of the epithelium? The question is asking like that. You have to answer very easily. Very easy answer will be there. I'm waiting for everyone's answer. Try to answer, everyone. Please, everyone, try to answer this question. This question is very good question. Try to answer it. This is also integrated with your obs and gynae also. It will help you into the obs and gynae and the anatomically also. Very basic question. Very basic question. Very good. This will be your ciliated columnar epithelium. This will be your ciliated columnar epithelium. And by this, you can understand in the ciliated columnar epithelium, which is going to lining of your inner lining of your fallopian tube, from the fallopian tube. And the fallopian tube, you already know, is the line by your ciliated columnar epithelium. And it is present in the inner hollow surface of the fallopian tube. We are talking about the inner, right? Inner side. So it is present in the inner hollow surface of the fallopian tube. Right? Very good. Again, question number 39, very, very important question, repeated 2 to 3 times in the FMGE. So I also put it this MCQ here so you will understand the particular thing. At what level does the spinal cord end in the infants? Now that I'm highlighting the particular thing, not asking about the adult, it is asking about the infants. And in the infants, reply me, in the infants, at the which level, your spinal cord will be getting ended? I'm waiting for your answers, everyone. Very good MCQ, very good MCQ. They can ask 2 to 3 times. 2 to 3 times they asked in the FMGE exam. Right? Try to answer it. Very good. Very good. Very good, doctor. Very good. I will surely clear you this upper border and lower border also. But here, if they didn't mention the upper and lower border, they are not confusing you with the upper and the lower border, don't go with it. Just remember what? L3. Very good. The L3 will be your answer. But now I can give you the more explanation also, because I know that examiner want to confuse you, right? Always the examiner want to confuse you, but if we are here, you will not getting confused, right? So what will be the particular MCQ they can ask you in the later part also? In the neonates, in the spinal cord will be getting and into the upper border of the L3. Now remember, just in the MCQ in the previous yearly, they asked about the L1 and 2, L3. So you answered the L3 very well. But now if they ask you in the options, maybe they can give you that lower border of L1, upper border of L1, lower border of L3 and upper border of L3. What will be your answer? Your answer should be the upper border of L3. Your answer should be your upper border of L3. And after which the chords moves up with the ages, where the adult, if they're talking about the chords slowly by the, as a neonatal infant is having the L3 upper border. As with the ages, this cord will be going to move up, and please understand this spinal cord will be terminate in the adults. If I'm talking about the adults, the spinal cord will be getting terminate at the lower border of L1 in the adult. So last time they asked about the infant, maybe they can ask you about this time what for the adult. So please remember, in the neonates, upper border of L3. In the adults, there will be the lower border of L1. There will be the lower border of L1. Right? Understand? Very good. Talking about this question, there is a dermatome of the area is marked given. You have to give the dermatome. And the dermatome is given in the posterior side also and on the anterior side also. The dermatome is given. Now reply me about the dermatome. I am waiting for your answers. What will be the dermatome here? What will be the dermatome which will be going to supply here? What will be the your answer related to this dermatome? What will be the your replies, guys? I'm waiting for everyone's answer. Just only 2-3 students are replying here. What about the others? Okay. Please remember, this will be the your L4 dermatome. Your dermatome will be here which L4. Okay. And why the L4? Please understand why the L4 will be here. The cutaneous intervention of the lower limb is here divided with the many forms from the segment of the L1 to L5 and then S1 to S3 of the spinal cord. And if we're talking about the partially from the segment of the T12 to S4, this will be the medial malleus and the medial aspect of the lag region, right? And it is having the proximally nerve, the proximal root of the value, the nerve which is called as the saphenous nerve. This saphenous nerve will be going to supply it the dermatome L4 the dermatome. At the saphenous nerve, which is called as saphenous, it will be going to supply at the level of the L4 dermatome. L4 dermatome. Right? Let's move forward. Next, again, your histopathological image, and it can be your physiological. It's integrated with the physiological or the anatomical question. The given is the histological section by the thyroid gland. Which of the following will be going to secrete by the cell marked with the X in this image? And you can see clearly here one cell is marked with the wrist round and marked with this X. Now tell me first, before going to the question, now tell me first, what is this cell? Which kind of the cell is there? Reply me about the cell. Doctors, I'm asking about the cell. I know as you know about the answer. Agree with you. But my question is here, name the type of the cells or the name of the cell. Which cell is it? Try to answer. The name of the cell. Try to answer the name of the cell. Very good, doctors. As the given in the, please understand the thing. As the given in the question only, that this is the section of thyroid gland. So now you already understand in the thyroid gland we have the follicular cell and also have the parafollicular cell. Very good. Also known as the C cell. Parathyroid gland यहाँ पे नहीं आएगा. The parathyroid gland will be not here. Please understand the thing. So your PTH will be removed here. PTH तो होगा ही. right? The section of only in the thyroid is given here. Although, if you can see here, this is the big follicular cells, and between this follicular cells, this is the small cell is given here. This will be your C cell, or you can say the parafollicular cell. And now tell me from this cell, which which thing will be getting secreted? Yes, this will be the secreted your calcitonin. Very good, guys. Perfect, right? Calcitonin. Talking about this calcitonin, if we're talking about this calcitonin, this particularly we have the particularly if we're talking about it, that particularly that the cell is identified as a histological image, the thyroidal tissue, which is your parafollicular cell, right? Also known as the C cell, as you already named there. Very good, guys. And they can be found into the basal lamina of the thyroid follicles, right? Without the acceding into the follicular cell lumen or between the thyroid follicular, or also known as the intrafollicular space between the follicular cells, it will be there. Either there is slightly or the in form of the group, the parafollicular cells produce the calcitonin. क्या produce करते हैं? It will be going to produce your calcitonin, and this hormone aids to the regulate. This hormone aids to regulate the blood calcium levels. This hormone will be going to this hormone will be going to this regulate the blood calcium level by the down regulating bone absorption, by the limiting the calcium reuptake in the kidneys. The calcitonin, sorry for it, guys. Sorry, uh, sorry. Just a minute. Sorry for it, guys. Right? Let's back to the topic. So we were talking about the calcitonin. You already know that calcitonin will be produced by your parafollicular cell, also your C cell, right? And what is the role of it? It will be going to regulate the blood calcium level by the downgrading the bone reabsorption and limiting this from the calcium reuptake from the kidneys. The calcitonin is working, right? Very good. Again, it's stuck. Just a minute, guys. Just a minute. More 10 to 15 minutes will be the more, doctor, and we'll finish this session. Last 10, 20, 10, maximum 10 minutes. Okay, maximum 10 minutes will be left here. Okay, just wait for more 10 minutes, right? And we'll finish this session. Just 10 minutes, right? Right. I hope this will be the interested session for you guys, right? Very interested session, right? So you covered this all the important previous year questions in just few hours, right? In just few hours. Okay, so this was about the your uh, calcitonin. We talked about the calcitonin. Okay, we talked about the calcitonin, which is your C cell, right? Related to your C cell. Okay, so calcitonin, we talked about it. It's regulate the blood calcium levels by the downgrading the bone reabsorption, or the calcium reuptake from the kidneys. Perfect. All right. Okay. Now moving forward for the next question. In this next question, we are talking about it. The identification. The question is asked. The question is asked. Identify. Sure. I am clearing you the thing. After the class, surely. After the class, the PDF will be getting uploaded in the annotated form if you want. If it's non-annotated, the link will be provided in the command box. Surely, the link will be provided in the command box also, and in the description of this video also. Okay, the PDF of this particular session will be provided here. Then the next query which is asked by the doctor, that need more session like that, I already announced you, doctor, the every subject PYQ sessions will be covered on this channel, so subscribe it. Okay, So we'll take all the subjects important PYQs here, right? So just be with us, and surely soon we'll provide you the all the PYQ sessions, schedule also. Okay, so you can join all the PYQ sessions by the schedule. Okay, by the seeing the schedule. Okay, okay, right, guys. Now check it out. Now check it out. The image, which is the question is asked to you. The identify the marked arrow, the arrow which is marked there, the structure they are asking you, and you already know this is the image of your heart, right? The gross anatomical heart is given here, and the option is given here: right atrium, left atrium, right ventricle, and the left ventricle. And this will be the arrow. This will be the arrow here, right? Now try to answer it. Any one of you? Someone is replying right atrium, someone is replying left atrium. What about the others? All right. Okay. So this will be your left atrium. What is it, guys? It will be your left atrium. By the grossly you are seeing that, please understand your art. You already know about the heart anatomy. Heart is divided into the two chambers, two atria and the two ventricles. Very good. Two atria and the two ventricles. The left atrium is one of the upper chamber of the heart, and the left atrium receives the oxygenated blood. Please remember, the heart in the left atrium is relating the oxygenated blood from the lungs via the pulmonary veins, and it contacts to push the blood into the left ventricle, which is responsible for the pumping the oxygenated blood out to the rest of the body. So then the left ventricle will be going to pump the blood into the whole body, right? This is the basic question, right? The next question is asking about the bicep brachii function as which type of muscle for the lifting the forearm. Bicep brachii function as which type of muscle for the lifting the forearm. It will be the synogastric muscle, it will be the fixator muscle, antagonist muscle, or the primary mover. What will be your answer? The question is asked related to your biceps brachii. Biceps brachii function is, you already know, which type of the muscle is the lifting of or the forearm. Try to answer. Very good. It will be your primary mover. What will be your? Yes, it will be your primary mover. What do you mean by the primary mover? The bicep brachii muscle is located in the upper arm, you already know, and play a role in the movement of the forearm. Especially it is the fixation of the elbow, the joint, and the primary mover, also known as agonist, also known as the agonist. And this muscle is primary role of the generating the specific the movement in the case of lifting the forearm and the bicep brachii contact really to the flexing the elbow, right, and the causing the forearm moving the upwards, right? Very good, very good, doctors. The next question, very easy and simple question. The prevention of the lateral dislocation of the patella during the knee flexion, right? Do the knee flexion, the patella will be the not getting the lateral dislocation. What will be the there to doing this fixation? Not tell me, not tell me. The first is the vastus medialis, B is the your patellar ligament, C is your gracilis, and D is your rectus femoris. Rectus femoris. Try to reply me in the chat box. Yes, the answer will be your vastus medialis. The answer will be your vastus medialis, and this vastus medialis is the in knee flexion. The lateral dislocation of the patella will be prevented by the action of vastus medialis muscle. Vastus medialis muscle, right? The next, all of the following are the paired cartilage. This is also the again and again asked in the previous year, repeatedly asking in your FMGE exam. Try to reply this last question and we'll finish this session here. All of the following are the paired cartilage except. What will be your answer here? What will be your answer? All are the following is the paired cartilage except. What will be the answer? Arytenoid, thyroid, uniform, and a conic. Which muscle is it? Which muscle? Try to answer it. This is a kind of a again the ENT and anatomical mixed question, but repeatedly they are asking 2 to 3 times, more than the 3 times they ask, more than the 3 times. Very good. Your answer will be here, thyroid. What will be the answer? Your answer will be here, the thyroid cartilage, right? If I'm talking about the thyroid cartilage, please understand in the larynx is made up of the 3 paired cartilage and the 3 unpaired cartilage. Now remember this. One is the paired cartilage, one is the unpaired cartilage. Total 3 is there. What are the mnemonic for them? The arachnoid, conicoid, and the coniquate. The arachnoid paired. These are the paired. The paired में क्या क्या आएगा? Arachnoid, cuneiform, and the cunicate. This will be in the paired. What is the unpaired? The unpaired cartilage is your epiglottis. Yes, your thyroid and your cricoid. Cricoid मुझे पूरा लिखना पड़ेगा, otherwise you will getting confused. So the cricoid, thyroid, cricoid, and your epiglottis are your unpaired. So remember with this mnemonic of it. When you remember it with the mnemonic, it will be much easier for you, right, to understanding this topic. Okay, so this will be the division of the paired and the unpaired cartilage. Yes, yeah, ACC is paired. ACC is your paired, right? And ETC, ETC is your unpaired. What is the ETC? ETC को आगे हम ETC के आगे हम R भी लगा देंगे ना. So ETC R. You can write a mnemonic, not writing the full cricoid. Will write like that ER, CR, right? So this ETCR, this ETCR is your unpaired. Okay, so the paired and the unpaired is divided here. Perfect, right? Okay, so thank you so much for this session, right? I hope you enjoyed this session. And one thing which I need from you, as I already announced, there will be the more PYQ sessions will be upcoming in the future, right? We'll take this all the subjects, mostly all the subjects will be taken in this PYQ sessions. And I request to you, all of you, follow me on my Instagram and follow me on my Telegram. If you have any queries, you can ask me there also. And soon, surely we will upload the schedule of the all the PYQ sessions. Will the schedule will be uploaded, like on which date will take with the which subject, right? So this particular session, this schedule will be also uploaded, right? So if you have any queries related to the anatomy, this session, any questions will be there. So you can directly contact me on my Instagram or on my Telegram, right? All both the handles are available there. Dr. Vaibhav Ahuja will be Dr. Vaibhav Ahuja, it will be my Instagram handle, and Dr. Vaibhav Ahuja will be my normal Telegram handle, right? The PDF will be getting uploaded by the team. Maybe tomorrow you will get the PDF. In the description box, the link will be uploaded in the description box, and the link will be uploaded in the pinned in the comment box also. Okay, the PDF will be available, no issues. Now the last thing which I want from you, after this uploading this video, after this ending this session, this video will be getting uploaded. Just I want from the everyone's, what is the feedback of this particular session? Okay, as the comment, please reply, please post a comment just after this uploading this video, and do a comment, right? Regarding this feedback of this session, whatever your feedbacks, I'm not saying always give the positive feedbacks. If you have any kind of the negative feedback also, or any suggestions for us, so please let me know in the comments, right? Thank you so much, and best of luck for your exams. And read anatomy well, right? Read the anatomy well, because this weightage of this anatomy subject is the 16 to 18 question will be there, right? 17, 18 will be there. As the blueprint there is a 17, but sometimes 16, 18 question will be in your anatomy, and it's much important for the you, and it's a basic subject, right? Okay, guys. Thank you so much. Thank you so much. Goodbye. Good luck.